Welcome to the Healing Arts and Medicine Music and Medicine Conference. My name is Wendy Goldberg, President and founder of the Benjamin Goldberg Foundation. And we are getting the slides queued up here for you. So thank you for your patience. And I just want to extend my sincere appreciation. Your presence today signifies a commitment to advancing medicine and embracing the healing power of the arts. You know, when my son Ben was in treatment for a rare cancer called neuroblastoma, we had the opportunity to explore integrated medicine and the healing arts during our time at Memorial Sloan Kettering Cancer Center. Ben was famous for his signature headphones, often his own music therapist, with his personalized playlists, engaging everyone around him. So it is our official or unofficial tagline here at BGF that these experiences may not have changed the outcome for us, but they did change our story. And I was witness so many times to the profound effects, not only for the patient, but the caregivers and the staff. So every time I get to share our story, it truly reinforces our mission to empower and support children and families on their medical journey. So it is an honor to be working in this space that is evolving, seems like so quickly. And I feel like the work of the Benjamin Goldberg Foundation is evolving with it. So today, we will explore the connection between medicine and the arts and how they bring healing and solace to our lives. The speakers all are finding innovative ways to enhance patient care and well-being. So once again, welcome. May this conference be a catalyst for new ideas, collaborations, and most importantly, a celebration of the healing arts and medicine. Now, let me introduce an exceptional individual who has played a pivotal role in making this conference a reality. Dr. Sheetal Ijmani, our medical advisor, has been instrumental in curating this program and gathering experts from the field of medicine to share their insights. So let's welcome Sheetal.
Thank you so much, Wendy. First of all, can everyone hear me okay? Wendy, can you hear me okay? I'm sure you'll let me know if you cannot. So welcome again. To reiterate what Wendy shared, welcome everyone. Thank you for spending your Saturday morning with us here. I know for a fact that we have some folks joining us even from California where it is 5 a.m. So thank you for being here. Thank you for waking up early and spending your morning with us. As Wendy shared, I am Dr. Sheetal Ijmani. I am the medical advisor for the Benjamin Goldberg Foundation, and my role here is to raise awareness of the role of the healing arts and integrative therapies in medicine from a scientific, evidence-based perspective. Having served as a pediatrician for over 16 years, I have seen firsthand the incredible life-saving technologies within our health systems for children and their families. I have also seen the gaps within the system when it comes to addressing the whole family unit and medical team on their healing journeys as well. Now, we know that pharmaceuticals and therapeutic clinical interventions are necessary and play an important role on the medical journey, but the healing doesn't stop there. In order to support the full healing journey, we must address the physical, mental, emotional, and spiritual realms. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. While the current healthcare paradigm in the United States is focused on disease mitigation, true health, as defined by the World Health Organization, encompasses much more than that. This is where the healing arts and integrative therapies play a critical role. So what are the healing arts? The healing arts are defined as creative practices that promote healing, wellness, coping, and personal change. Traditional healing arts therapies include music, art, dance, movement, poetry, writing, and drama. Further described by Montefiore Health Systems, and I quote here, Incorporating the healing arts into health is part of a humanistic perspective, one that acknowledges the role of beliefs, emotions, stress, social connections, environmental factors, creativity, and spiritual connection in health and well-being. It takes the broadest view of healing, that health is not just the curing or absence of disease, but the fostering of positive opportunities for self-knowledge, growth, and resilience. But successfully implementing these powerful therapeutic modalities into our health systems and healing journeys starts with awareness and education. That's why I'm so excited to present to you today the Benjamin Goldberg Foundation's first annual Healing Arts in Medicine Conference with a focus on music in medicine. Today, you'll hear from 5 outstanding speakers, all experts within the field of music in medicine. By the end of this conference, you'll learn how music affects the brain for health and happiness, how music therapy is used in inpatient pediatric settings, how private practice music therapy bridges the gap for patients no longer receiving inpatient services, how music exposure restores personhood in hospice palliative care patients. We'll close out the morning with an engaging panel discussion and an opportunity to get your specific questions answered by our experts. Our expert speakers will share ways that you can take what you learned today and apply it to your life. And if you're a healthcare professional, how you can begin to integrate music into your practice. But before we dive in, I invite you to take a moment now to think about what music means to you. What role does music play in your own life? Take a moment to consider this question. Maybe jot down your thoughts on a piece of paper. And if you feel comfortable, use the Q&A box that you'll find at the bottom of your screen if you're on a computer to share your responses with us. As you're doing that, I can definitely share that music has and continues to play a large role in my own life. Although not a musician myself, music has the ability to completely transform my environment and my mood. It has the ability to take me back to fond and tender memories and emotional experiences. I have used music as an intentional distraction to cope with stress and anxiety in a variety of situations. Listening to music, especially live music, is definitely one of my happy places. So what has music meant for you in your own life? As we're getting started, take a moment to consider this question for yourself. And as I mentioned below, as I mentioned before, please use the Q&A box to share your responses and thoughts with us. So while you're continuing to consider this, I want to cover just a few logistics for this morning. First, you'll notice that we're using Zoom webinars, which does not allow for a chat function. However, we still want to hear from you throughout the conference morning. So please use the Q&A function. It is at the bottom of your screen if you are on a computer. And you can also, if you'd like to, and if you feel more comfortable, you can also chat your questions and comments in that Q&A box as anonymous. So please use that to ask questions, leave comments, and to engage with our speakers. And please also note that while we encourage you to submit your questions as they come up, we will pose your questions to our presenters during the final panel Q&A towards the end of the event. Also, please be patient with us as it will take a moment to bring up each panel speaker at the start of their presentations. We have built in a 15-minute break this morning so that you can use that time to grab a snack and stretch out. And with that, I would like to go ahead and introduce our first speaker. Our first speaker is Dr. David Meyer. Dr. David Meyer is a pediatric psychiatrist at the Children's Hospital of King's Daughters in Norfolk, Virginia. He attended medical school at Western University of the Health Sciences in Pomona, California, and then completed a family practice residency at VCU Medical Center in Richmond, Virginia. After practicing family medicine in New Mexico and Virginia, he decided to pursue a second residency in psychiatry at the University of Virginia, followed by a fellowship in child and adolescent psychiatry. Dr. Meyer has been recognized as a top psychiatrist with Best Bedside Manner in Shenandoah Valley, Central Virginia, for 2 consecutive years, and his commitment to his patients is truly exceptional. Beyond his medical expertise, Dr. Meyer is an avid violinist who weaves the power of music into his practice. He uses his passion for music to establish therapeutic connections with families and transform lives. He has attended summer strings camps focusing on Appalachian old-time music and bluegrass and has recently started performing in small venues. Today, Dr. Meyer will be speaking on the topic of the musical brain, tapping into the healing power of music for health and happiness. Welcome, Dr. Meyer.
Thank you. I'm going to switch to share screen and bring up my slides. Let's uh, there we go. Okay, can everybody hear me okay? Okay. I want to thank everybody I want to thank, first of all, Wendy Goldberg and the Benjamin Goldberg Foundation for presenting this wonderful conference, and especially also Dr. Rajmani um, for her excellent work and putting together this. And I also like to thank you all for getting up your Saturday morning on a Super Bowl weekend to attend this and to learn more about the role of music and music therapy and patient care in medicine in general. And so, with no further ado, I will go ahead and proceed. Um, no disclosures, just objectives really quickly. I'd like to inspire you to actually attend one musical performance in the next 30 days. Um, and, uh, and to consider picking up a musical instrument or to inspire a young person, child or an adolescent to an instrument, or if they have once been involved in music and no longer, maybe to revisit that um, as a way of promoting their own growth and health. Um, so just a few, I know the folks that will succeed me are true music therapists, and I am not a music therapist. I'm a psychiatrist, and so I kind of come with less of a knowledge base in terms of music overall. So just remarking, in my experience, I'm a child psychiatrist at Children's Hospital, the King's Daughters, and I work in the consultation liaison. So I see children on the general medical floors at CHKD who have been hospitalized for medical problems, such as leukemia, cancer, um, infections, pneumonia, exacerbations of asthma, diabetes, and other things. So um, I work closely with Chris Bird, especially, who could be following me, and we've worked together and collaborated on several patients, and I could attest to the power of music therapy in helping kids heal and get to a point where they're experiencing well-being in their life, just as Dr. Rajmani has alluded to earlier. Um, so music therapy as a health profession dates back, to earlier in the 20th century, and especially following the World Wars, World War I and II, where it was found that it was very helpful for recovery and soldiers that were wounded in the battles. Um, it helps utilizes the physical, mental, social, and spiritual aspects of music to help patients improve and maintain their mental, emotional, and physical health. Studies have shown that it does reduces pain and improves relaxation and allows children and adults to express themselves in a normal environment. In my experience, music therapy can be applied virtually anywhere in the healthcare setting. outpatient, inpatient. Um, CHKD has the advantage of having an excellent music therapy department where music therapy can take place in patient rooms or the playrooms where children can gather to get away from their the stressors of being in the treatment units. In mental health, where I spend most of my time, music therapy can be very effective. We're in the process. We've opened up our children's pavilion, which um, is composed of inpatient beds for kids with acute mental health crises, as well as a partial hospital program in intensive outpatient. And music therapy has really been started and is an important component of the overall treatment plan on those services. And furthermore, there is also a full music studio for recording, and so we're in the process of working to develop the programming for that and to develop ways to benefit um, the most in the best and most efficient manner. So so I'm going to start to talk a little bit about my musical journey. Um, I did play piano for 2 years, but it didn't stick. I played drums in a middle school band, and did that for a while. My wife will say that I still am a drummer because I tap on things and that sort of thing. But I enjoy that a lot. I think I always had a passion for strings and the violin through my exposure to both classical music and Appalachian folk music, as well as bluegrass. And the picture you see is Marino's Lunch. It's a small venue in Stanton, Virginia, that my brother bought and turned into. Well, actually, historically, it's for about 100 years. It was a speakeasy back in the 1920s. Was a neighborhood grocery store for an African American community, um, and later became sort of a gathering place for jam sessions for bluegrass and old time musicians. Um, so he bought this, and this has provided a venue for me to sort of learn and develop my skills in a group jam session. Okay, so why is music important, and why do we like it so much? I think music is health enhancing. It can enhance creativity and also intelligence. It helps a person's social life, especially as I've kind of alluded to and pointed out. Playing with other people is really important. That definitely ups your game as far as being able to perform. And it's a big, amazing stress reliever. And basically, I think the most important thing is the love of the music, and what it can do for you. And so, yeah. There we go. I had another video, but we're gonna skip that in the interest of time. Um, when we talk about music, the ancient Greeks had um, a term for sort of the well-being that Dr. Ashmani alluded to earlier, that is eudaimonia, and it's often used in conjunction with living your best life, in terms of functioning well, having a purpose beyond yourself, you know, um, seeking a deeper happiness. This is sort of in contrast to hedonic well-being, which is focused on the visceral pleasures, which are important, and you have to have a balance between hedonic well-being and eudaimonic well-being. Um, so, eudaimonic well-being is focused on the aesthetics of music and the arts, and tend to be somewhat more, sustainable. One thing is that when people get involved in um, sort of artificial modes of reinforcement, they they can actually hijack their enjoyment of both regular, the visceral pleasures or the hedonic pleasures and the eudaimonic pleasures. And so, especially, chemical addiction and chemical dependency can take you off in a different direction and make it more difficult to experience your life at its fullest potential. I want to get more into the brain physiology, and I want to show you the structure of the neuron. Neurons are specialized cells in the central nervous system, and certainly they're designed for intercommunication. And so neurons are, composed of the cell body, the dendrites, which are receiving the chemical signals, and the axons that are transmitting chemical signals. And when you talk about the brain, the cortex is composed of the cell bodies, these neuronal cell bodies, which then send their axons lower into the brain and into the rest of the body through the spinal cord. And they're specialized for, of course, very rapid communication because of this myelin. Myelin allows intercommunication, and especially these nodes that you see in between are called nodes of Ranvier, and they allow for rapid transmission of signals. Back in 1928, it was postulated that there was only neuronal growth or neuronal division early in embryonic and early postnatal life, and lately that neuronal hypothesis has been somewhat questioned because there's increasing evidence that there could be new cell growth later into adolescence and later adulthood. It's been shown that practicing music, learning music through music therapy, and practicing music can, increase the formation of myelin, which allows for stronger connections in between nerve cells and their targets. Looking at the brain structure, we've all seen this. The brain is the cerebral cortex are divided into two cerebral hemispheres, the right and the left, and the frontal lobe is the front part of the brain, is really the planning and executing part of the brain, specialized in executive functions. The temporal lobe at the bottom is focused on hearing, memory, and language. The parietal lobe has the somatosensory cortex here at the top, and is specialized in sensory modalities and sensory integration. And the occipital lobe is focused on vision and the processing of visual stimuli. And so all of these, when somebody learns music, listens to music, learns music, and practices and performs, all of the brain regions on both cerebral hemispheres can be involved. People do make a great deal about right brain versus left brain being specialized for language, and right brain carrying the melody or the harmony. So in reality, though, it's networks that are involved. So the right brain, left brain division is not always, has been shown to be not always totally valid, although there is some specialization. So this is an illustration again of how musical training shapes the brain. with the parietal lobe, with the frontal lobe especially, there's increased gray matter volume, and this is true with all of the various regions of the brain. This has been found through increased functional MRI, showing increased metabolism and increased oxygen consumption in these regions. I'll point out the cerebellum at the bottom is very important in terms of movement execution and rhythm, maintaining rhythm. In the temporal lobe, the primary auditory cortex is called Heschel's gyrus, and that is extremely important in learning pitch. So people with what's called perfect pitch sometimes will display increased cortical thickness in the Heschel's gyrus, suggesting that there's a greater density of cellular bodies. This is sort of another illustration of the below the cortex is the deeper structures of the brain. Most importantly is the amygdala, which is sort of your alarm system, so to speak. And the amygdala is important in emotional processing of music, processing of music-evoked emotions, and experiencing pleasure and reward. Anyone's heard a song that elicited a pretty strong response emotionally, either it says, "Oh, I hate that song," or "I love that song. It really overwhelmed me." That's sort of the amygdala. The hippocampus is important in episodic memory. It's important in the, playing by ear and recognizing music, recognizing the contour of music. So the hippocampal volumes can be affected by musical training as well. Music is transmitted through the auditory pathway and the visual pathway. And here's an illustration of the pathway to the auditory cortex, where music is first, or any auditory stimuli is first perceived, and then sort of through communication with other areas of the cortex is processed. So going into this a little bit further, information from the auditory cortex is transmitted to the frontal lobe, which associates the sound with varying patterns that generate thoughts, feelings, and stimulate emotions and past experiences. The frontal lobe is also very important in planning a performance or composing. The visual pathway is important in music, especially in reading music. And visual stimuli enter through, processed by the photoreceptors in the retina, the rods and the cones, and the optic nerve sort of diverges in the optic chiasm and then radiates back to the occipital lobe from the lateral geniculate bodies. So this is important because when you're reading music and trying to modulate your performance, integrating the visual with the auditory is really important. Components of music processed in the brain include rhythm, pitch, and tempo, and how fast music is, contour, the direction of a melody, whether the music is going in an ascending pattern, like for example C, D, E, F, G, or in a descending direction, and a lot of pieces it can be up and down. Timbre is the unique properties of, you can hear like a middle C, and it can sound very different whether it's from a violin or a vocalist, and the volume of music. there's functional MRI studies of different of performing musicians. We don't have to spend too long in the interest of time, but basically, there, whether you're improvising or composing or improvising can have different brain regions being activated. So improvisation can open up areas of the brain that are very different from when you're just playing a piece from sheet music. One study that is very important and really sort of came out in 2014. Dr. Hochak at the University of Vermont studied actually 232 actually children aged 6 to 18 using functional or MRI T1 weighted images, and the question was whether musical training really caused brain structural changes. So the subjects or the children were matched using the Wechsler abbreviated intelligence scale, and the results of this study showed that musical training was associated with increased cortical thickness in several areas of the cortex. Most importantly, the dorsolateral prefrontal cortex involved in aspects of executive functioning, including working memory, attentional control, and organization and planning for the future. So probably, in terms of performing and playing, the dorsolateral is extremely important. Going back to, the picture of the brain, it's definitely in the frontal part of the brain, lateral side. And so interestingly, in kids with ADHD and other problems with attentional regulation, the dorsolateral prefrontal cortex can be underactive. So musical training can, in a sense, correct that those deficits and normalize those kids' functioning, and in a sense, maybe obviate the need in the future for medications such as psychostimulants. Another area that can be affected or was shown to be affected was the orbital frontal area of the prefrontal cortex, and that was shown. The orbital frontal cortex is important in regulating impulsivity and also emotional regulation. And we find in my clinical work, I find that a lot of kids with problems with focus and attention and other problems can have problems with both of these things. And so, musical training can help that. It teaches a lot of frustration tolerance and working through difficult situations and pieces. Of course, the premotor cortex, where is involved in preparation and sensory guidance of movement, the kind of movement that you need to make while you're, playing music or imagining that you're composing music. You're trying to imagine what kind of movements will be required. And then the motor cortex, of course, is you're responsible for the execution of movements. And music is about, producing music and performing is about, really producing mechanical waves, sound waves that will be perceived as some sort of organized, organized sound. That's what music is it's sound that's organized in a particular way. And so all of these brain areas were shown to be, more fully developed. The rate of maturation was much earlier in kids who had been musically trained. Other areas were the supplementary motor area, and which is involved in the planning and execution of movements in the parietal cortex, which basically takes sensory information from various contexts, both the auditory and visual information, and allows that to be processed. So getting sort of to the end of my talk, these are some additional resources, some really good books that I used as source material that show, really illustrate and go into much more detail. So if there is, I'm sure additional interest on the audience's part, these are very good resources which I can send to you. Um, so operationally, we know that music therapy helps in the clinical setting, and hopefully it might inspire kids and adults to really take this further in their lives and use it to build a sense of wellness. And that's sort of the gist of my talk. And so one Dr. Huchak, who did the earlier study on the cortical thickness, runs the Vermont Center, or actually he's actually in another role right now, but formerly he was the chief of psychiatry at the University of Vermont, and he did have a program where he brought in kids, gave them all violins or violas, and gave their parents violins or violas as well, and had them all, learning to play, and so his notion and his hypothesis in the program is based on the idea that music is one component of this idea of wellness, is learning music, uh, having a fitness routine every day which promotes brain growth, having a program of mindfulness, either meditation or some sort of mindfulness activity, nutrition, and sleep. And so these 5 components of wellness he's also taken into another realm of working with college students, so freshmen at the University of Vermont who are coming in, that they all get violins, and learn music as one component of their education, even if they're not music majors. Another organization is called El Sistema, which is an education program started in Caracas and is now spread to the U.S. And it's helped, really focused on kids that might not have an opportunity to learn music, but it's actually served 2 million children in the U.S. and about 1 million children in Venezuela and other countries. And it's reduced school dropout with a 22% increase in participation in community activities, as well as 20% increase in employment in later life. So those are significant gains, really. Concluding, the study of neuroscience, when you look at the music, listening, performing, and therapy, is rapidly growing, and we know that music therapy works. There's a lot of evidence that music can have beneficial effects on emotional states and can facilitate brain health and emotional regulation. I think music in my life has really made a big difference in my well-being, and also has tremendous effectiveness and potential for increasing the quality of life for all individuals. And I know that it's a very important component of the healing arts. I thank you for coming for this presentation, and I appreciate the opportunity to speak with you.
Thank you so much, Dr. Meyer, for that wonderful presentation. Thank you for sharing a bit of your personal experience, as well as the neuroscience as a pediatrician who specialized working a few years in the field of neurodevelopment. I loved hearing about the neuroscience there, as well as some of the practical applications of programs that are currently using that as well. So thank you so much, Dr. Meyer, for that wonderful presentation. Before we bring up our next speaker, Chris Bird, I just want to remind you that we do have the Q&A function, and we invite you and encourage you to use that to share your comments with us, to leave any questions as they come up for you so that you don't forget your questions by the time we get to the end. We will be continuing to look at the Q&A section throughout the morning, and we will present your questions during the panel Q&A towards the end. So I see a few comments here already of folks sharing the significance that music has played in their own life already. So thank you so much for sharing that. I'm just going to skim that and share a little bit of that. So that music draws me in, makes storytelling fun, makes me feel good, unifies me with others with common experiences and values. Music and movement always having been a part of my life. Let's see. Helped manage the stress of an accelerated journey through college and medical school. Music has helped with mental health over the years and transformed mood. So thank you so much for everyone for sharing your experiences so far. Continue to use that Q&A box to share your comments, questions with us. And now I would like to introduce our next speaker, Christopher Bird. Christopher Bird is a board-certified music therapist from Chesapeake, Virginia. He obtained a music therapy degree from East Carolina University and completed his clinical internship at Allegro Music Therapy and Music Education Services in Greensboro, North Carolina. In 2019, Chris returned to Virginia and began working at the Children's Hospital of King's Daughters, where he sees patients in intensive care, hematology oncology, progressive care, inpatient rehabilitation, and medical surgical units. Today, Chris will be speaking to us about music therapy in pediatrics. Welcome, Chris.
All right. Hello. Can you hear me? We good?
Yes, we can hear you great.
All right, cool. So, what is music therapy? This is the official definition of music therapy on the AMTA website. I just wanted to talk a little bit about the parts that I have bolded first. So, by evidence-based, that means like what Dr. Ajmani said at the beginning. It's we integrate the best available research that we have. Um, the music therapist's expertise, as well as the needs, values, and preferences of the individuals that we serve. And by individualized goals, it means that the objectives are set to each specific group or client. And by a credentialed professional and a music therapy program. So it is the music therapy degree is a 4-year bachelor's or equivalency, and the education has to be approved by our governing body, which is the American Music Therapy Association. Um, so when I took my classes at ECU, we started with the classes that all music majors take. So music theory, history, sight singing, ear training, your large ensemble, small ensemble. You take your private lessons on your main instrument. Um, and all music majors have to do at least 2 semesters of piano. And then specific to the music therapy degree, it's 2 more semesters of piano, 2 semesters of guitar, 2 semesters of voice, 4 semesters of practicum with a different population each semester. And for your practicum, you're going to be under the supervision of either a board certified music therapist or another credentialed professional for whichever setting. And then after your university coursework, you do your clinical internship. It's roughly 6 months. After you do your internship is when you get your diploma, and that's when you can take your board certification exam. After you pass the exam, you're officially board certified, and then you can practice, and you have to do your continuing education, and it's 100 credits every 5 years. I just finished my first cycle, so gonna start the next one. All right. Next. All right, so why does music work? The one I want to speak to in particular is the second point that I have starred. Um, that it occurs in all cultures, and often we've probably heard the phrase music is a universal language, and that's partially true, like making the generous assumption that all cultures have something that they would define as music. doesn't necessarily guarantee that the interpretation of that music is the same in all cultures. Just like language, like uh, we speak English, they speak English in Canada and the UK and Australia. But if you, as an American, go to a restaurant in Australia or the United Kingdom and you ask for a lemonade, what they'll bring you is a Sprite. And it's like, why did you bring me a Sprite? I asked for a lemonade. Like, this is lemonade here. We just call it something different. So might use the same word to describe a different thing. And it's the same in music, even like person to person, each individual's response to music or any piece of art really can vary. The example I normally give a lot is with the song "You Are My Sunshine." Like my mom would sing that song to me and my sister growing up, but now when my sister hears that song, she cries. It's like the floodgates are open every time because of that like intense emotional connection to the song. I have that emotional connection to that song as well. But now, like, as a music therapist, I might sing that song like several times a day, several times a week. So, so that connection is still there, but it's just not at the forefront anymore. It's literally my job to sing that song. So, like, yeah, we grew up in the same house, but yeah, it's a different response based on our experience, which brings me to the next point. All right, this is a YouTube video that I wanted to play a little bit of. So that song is called Fabadihan. It's a song from Madagascar. It's called Turning of the Bones. So it's in a language that we don't speak. So what we have to do is to determine like what we might think of it is listen to the other things like the melody, the timbre, the tempo. So like that song sounds like I would say happy to us. That the song is used as what's the word? A like a processional. The ceremony is when they go to the graves and they dig up the corpses and they like talk to them, dance with them. It's like a celebration of life and death. They put like new clothes on them and they wrap them in new bags. It's really interesting. Um, but what's pretty cool is we don't have the same relationship of life and death as they do in that culture. So when we think of death, we might have like really sad songs. Not always, but the norm is like slow, somber, sad, quiet. But this is like happy, marching, right? It's really interesting. I like that a lot. All right. The notes are the same, melodic contour is the same, but the way that we interpret it versus how they interpret it is different based on our experience and culture. And another example of interpreting things differently is an activity I'll talk about a little bit later is lyric analysis, where you will, in a group setting, often you'll play a song and you'll stress that there's no necessarily right or wrong answer to how you interpret the lyrics. But if you do it in a group, you will get like wildly different responses. Uh, how your participants analyze the lyric, and part of the fun is hearing how they come to those conclusions. That's my favorite part. Okay, next slide. All right, so next part. What do music therapists do? The TLDR of music therapy is to use music to accomplish a non-musical goal, right? And we do that in sessions and interventions for patients and groups based on their individual needs and preferences. Great. So the referral process for where I work, it's pretty informal. We have our morning huddle, and I'll have the kids that I or the patients that I have been seeing at least semi regularly, and I'll know what to work on with them. And the child life specialists, they will tell me like the kids that I haven't met yet, if they've gotten a report, they say, Chris, I think it would be good for you to see this patient because it might be good to work on this. Um, some might say, uh, like, "Oh, maybe see this person, he likes music." Like, that's good that they like music, it's a good start, but, like, if you have an idea of one of these things to work on, that would give me a better idea of where to start. So, I can either get that from their charts, I can get that from a nurse or a child life specialist, or I can, like, go in and do my own, uh, informal assessment. Right. But music therapy is not like a one size fits all. Sometimes it's not appropriate to do music therapy, like cultural or restrictions on music. One time at Huddle, we had a patient. They said like, "Oh, for a patient in room like 701, no music." And my first thought was, that's interesting. Like, why no music? Um, then I learned that they were Muslim, and some Muslims, like the way they interpret their doctrine, is that it prohibits playing musical instruments and listening to music, and it's yeah, yeah, and it's not up to me to decide like, well, I think music is good, so I'm just going to go in there anyway. No, we have to respect their wishes, and you can make the case to where some might accept like music as a form of medicine and healing, but you can offer that. But if they say no, you don't offer your services. Um, Next is altered mental status, dissociative symptoms, and difficulties in self-regulating. Like, well, adding an extra stimulus or an extra person in the room could be overstimulating. Like I've been in rooms where even like you can play your guitar or whatever instruments you have as quietly as possible, and it'll be too much. And that's like not anything that you can control. If it's not appropriate, it's not appropriate. Maybe try again later. And if it doesn't work, it doesn't work. Um, for PTSD, we often associate music with memories. Some people might have songs associated with traumatic events, and it could be triggering to them if they aren't prepared to process those feelings. One time, I saw this patient on our med psych unit. He said he really likes listening to Juice World. He was like, "All right, so we could listen to some Juice World." I pulled some up, and we started listening. Got maybe halfway through the first song, and he's like, "Oh no, I can't listen to this. It's making me want to use. It's making me want to do drugs, which is like the reason why I'm in here." And this was like my first time meeting him. Like I didn't know like if he would be willing to open up about that. So I asked him like, "Do you want to talk about why it makes you want to use drugs? Like if you're comfortable talking about that?" He's like, "No, I'm not ready to talk about it right now. Can we? I still want to listen to music though. Can we listen to something else?" So that was him telling me how music could cause harm. Like music absolutely can cause harm if it's not like used in the right way. So the next thing I wanted to talk about is some of the interventions I used. Um, with music speech stimulation, let me get this. So the idea is to use uh, completion or initiation of an overlearned phrase or to a familiar song with lyrics that you might know. But the key is to do a familiar song. So if I were to do something like um, "Wish that I was on old down in the Tennessee hills." So if you know the song Rocky Top, um, that would work for you. If you don't know the song Rocky Top, then that's not going to be very effective. So that's another thing that you would do an assessment to determine your patient or your client's preferred music, and then you can um, use those songs that they know to facilitate uh, that kind of activity. And next is like songwriting. You can do like a filling a blank or change words to a familiar song. I'll give another example of like "You Are My Sunshine." If they know the song "You Are My Sunshine," they can sing the melody to something that they might want to sing about, something that they're feeling. Well, like example, like, well, "I've been in the hospital for a week now. I really hate getting poked. They poked me yesterday and again this morning. I just want to go home." Yeah. So that's something that could be worked toward. Absolutely. And another thing that we've done for improvisatory songwriting is you can use like a backing track on YouTube. People, they compose instrumental beats and upload them on YouTube that people can use to like practice their original songs, and then they'll freestyle about whatever they wanted to sing. A couple weeks ago, I had this patient who really liked rapping, so he would just we would either pull up an instrumental on YouTube, or I would play like a progression on loop on guitar, like a 2 chord loop, and he would sing about like how like he wanted to go home. He would sing about his support system, his friends and family. He would talk about how he's so excited to do all the things that he wants to do once he goes home. He's like all of the hospital staff members that were helping him. He was really grateful to have that opportunity. And for music assisted relaxation, um, you can like either have a script, like a guided meditation, and you can either have like uh, an instrumental recorded in the background, or you can do it with your guitar. And then for music listening, that can so sometimes you might want to just like hide in my headphones, right? So um yeah, so some you might just want to listen to music with another person, and sometimes they might not necessarily relate to the lyrics. They just want to listen with another person in the room, which I've done. And then that can also eventually turn into a lyric analysis where you can analyze the words each song, like different parts of the song, and determine like whether or not those lyrics are like relevant to your experience or whether they're not relevant to your experience. And then for therapeutic music instruction, I've done usually either ukulele or guitar. And you can start from like nothing. The cool thing about ukulele is that there's only 4 strings. It's less complicated to learn than guitar. You can start with like, well, this has 6 strings, but the idea is you can just, oh, one finger, these bottom 4 strings here, 1 chord, oh, and if you slide it that way, that's another chord. Or this way, that's another chord. And then open, that's also chord. Yeah. So you can start there. And then over the course of their admission, depending on how long they have, you can like overlap these. So like if you start on ukulele, you can eventually maybe compose a chord progression and write original lyrics that might express how you're feeling. And I wanted to talk about some of the patients that I saw next, like that story in particular. There had a 12-year-old girl who was admitted for um, disordered eating and suicide ideation. She'd never played an instrument before, but she saw the ukulele on my cart. She's like, "I want to play that." So I taught her, 3 chords, and I like, "Oh, like, what kind of music do you like?" Like, she's like, "Oh, I like the Beatles." I'm like, "Oh, wait, we can play, Twist and Shout. That song has 3 chords." And then over the course of several sessions, she got really good at switching chords right in time to the point where she could, play in time with the recording, and it was, like, perfect, and she knew the words and everything. And then, unfortunately, she was, admitted again, like, more than a year later, but she was excited to tell me, like, how she eventually like joined a band and started learning how to play guitar, and I was like, oh, that's cool, like, do you want to show me like what you learned? So I handed her my guitar, and she was really good. She's learned how to play like different chords and melodies, and she started like singing and playing keyboard as well. It was nice to have like someone who had never picked up an instrument and then had that ukulele as the jumping off point for her musical journey. And then another patient I had was a 16-year-old hospitalized for complications with Crohn's. She had a musical background. She played flute and band, and she liked to listen to music with her friends. She also liked to play the ukulele. And then to the point where like we had a hello song, and she's like, "Oh, I want to learn the hello song on the ukulele." I was like, "All right, let's do it." She would sing the hello song and tell me how she's feeling, like unprompted. I'm like, "All right." And then that would eventually like lead to her um singing songs that she likes, like various pop songs. um Next we had a patient, a 5-year-old, who was admitted for AML, and this is one's about like a patient um making the decision when to not have music, because he came from a very musical family. Like, music was his favorite part of every day. Those are his words, his parents' words. Music was the highlight of his day. Um, but what he hated was pokes. They were an ordeal every time. Like, but so I gave him the option. I said, "Hey, um, I know these pokes are really hard for you. Do you think that having music during those procedures could help you?" And he said, "No music during pokes." So like he's old enough to know that he didn't want this 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 time that he loved to be tainted by music in any way. So I would say, "Do you want music? Do you want me to come back and we can do music again after your poke?" And he said, "Yes, music after poke." All right. Um, Last one. Um, let's see. What's the last one? All right. I had there's a 16-year-old who was admitted for a kidney transplant. She was in like an arts academy. She's a vocalist. Um, it would start off with us, or well, her sharing the music that she likes, and she would talk a little bit about each song. Like, oh, I really like the instrumentation. I really like the melody. I like this person's voice. But eventually, she was like, "Well, what kind of music do you like to listen to?" I was like, and that made me think a little bit. I'm like, "Huh, I wasn't prepared to share about me here, but I did." And she really valued the authenticity of me sharing with her. Like, we can both be vulnerable to the point where we played this game called Bop Banger Jam. So there were like certain criteria for each song, and when one person picked a song, we had to, determine or guess what the relationship the other person had to that song. And if we guessed right, they would have to say, "You're right or wrong. Here's what it actually is, and here's why." So that allowed for um, a little bit of self reflection on both of our parts. So yeah, I think that's about everything I wanted to say. Yeah. Uh, Thank you for letting me speak.
Thank you so much, Chris. This was such a wonderful presentation. Just so many wonderful points and nuggets that you gave us today. I want to reflect on a couple of things. First of all, I really appreciated you sharing about music being in all cultures and just how our experiences and our backgrounds and our cultures can kind of influence how we interpret that. I thought that was really helpful. I also really appreciated that you went over some contraindications as well, especially, we have a diverse audience here, some within healthcare, some who are not. But I think, particularly speaking from someone in the healthcare profession, I think it's really important, as we know that the healing arts are generally very, very positive and very few contraindications, it is important as healthcare professionals to know what those contraindications are. So I really appreciated that as well. I also, when you were sharing, I went to my other room, and although I'm not a musician, I do have a ukulele. And so I pulled out my ukulele. And because, I'll say I am not a musician, but the ukulele to me is a very an instrument that felt very not intimidating, much like the patient that you described. Like it felt like one that I can pick up and just kind of mess around with and play with. And it felt very not intimidating to me to start. So for everyone who's joining us today, piggybacking on Dr. Meyer's presentation, where one of his goals and intentions was for attendees to just try pick up an instrument. And then after hearing the wonderful stories that Chris shared with his patients as well, I hope that inspires some of our attendees as well. So thank you again, Chris. And we will go ahead as we're bringing up our next speakers. Just want to remind you, some of you have started using the Q&A box. Please continue to do so. I am noting any questions and we will present those to our panelists at the end. And our next speakers are Danielle Cavazos and Megan Buhmann with Tidewater Music Therapy. So Danielle Cavazos is a board-certified music therapist with degrees in music education, teaching, and music therapy. She completed a Bachelor of Music Education and a Master of Arts in Teaching at Christopher Newport University. Soon after, she attended St. Mary of the Woods College to complete the equivalency program for a Bachelor of Music Therapy. There, she completed music therapy clinical hours with older adults dealing with memory loss, as well as with children in palliative care. In January 2020, she completed a 6-month-long internship at Eastern State Hospital working with adults in inpatient psychiatric care. Currently, Danielle is the co-founder of Tidewater Music Therapy, where she works with a variety of clients, including older adults, cancer patients, survivors, and caregivers, middle school students with a variety of needs, children and adults with autism spectrum disorder, children with developmental delays, and children with physical disabilities. In addition, she maintains her teaching certification in Virginia and recently completed a NICU music therapy certificate. Megan Buhmann is a board-certified music therapist with a bachelor's degree in vocal performance from Christopher Newport University. She has spent the last several years studying, performing, and teaching music to children and adults with a wide variety of needs and skill levels. While completing her music therapy clinical hours, Megan gained valuable experience in using music therapy interventions with older adults within memory, hospice, and skilled nursing care, children and young adults diagnosed with autism spectrum disorder, as well as young adults with physical and intellectual disabilities. She is also the co-founder of Tidewater Music Therapy along with Danielle, and she currently works with adults in inpatient psychiatric care, providing music therapy assessments, treatment plans, and both individual and group music therapy sessions. Megan is very passionate about her work as a music therapist and believes in the intrinsic power of music to help and heal. Today, Danielle and Megan, both co-founders of Tidewater Music Therapy, will be sharing their experience of music therapy in private practice. Welcome, Danielle and Megan.
Good morning. Thank you so much for having us at this wonderful event. My name is Megan Buhmann. This is my colleague, Danielle Cavazos. And we're delighted to present to you today on music therapy in private practice. Get your singing voices ready and stay tuned for a brief mock music therapy experience towards the end of our presentation. All right, so we wanted to start today just a little bit about our mission and purpose. After Danielle and I graduated with our prospective degrees in music therapy, I don't think either one of us could have imagined that we'd be co-owning and operating our very own private practice. 5 years later, and here we are. We're so honored and grateful to have established a practice where clients of all ages and abilities can receive music therapy services within our community. I'd like to share with you our mission statement. Tidewater Music Therapy is a private practice serving the Hampton Roads community. TMT, as we love to call it, is comprised of three passionate board-certified music therapists specializing in children with special needs, teens and adults with mental health needs, and older adults with rehab and memory care needs. We offer individual and group sessions both in our private studio as well as in client homes, and we'll get more into that a little bit later. We have been providing music therapy services to the Hampton Roads community since 2019, and we hope to continue spreading the word across the Tidewater region of how music therapy can improve the lives of many. As a private practice, we provide music therapy sessions at a variety of locations throughout our region. We do have our primary office for individual and smaller group sessions, but we also provide music therapy services within client homes, assisted living and memory care facilities, and even the public library. If we were to observe an MTBC in private practice for a day, we can imagine the flexibility and creativity required to provide music therapy services for a wide range of clientele. A typical day might start with a session preparation, followed by some individual clients seen in the office. After a quick lunch break and some note writing, our music therapist may then pack up their car with as many instruments that will fit and head out to an assisted living facility for some group music therapy. Before the day ends, our music therapist makes their last stop of the day at a client home for an individual session. So a couple of our presenters have spoke a little bit about referrals, and we wanted to kind of speak specifically about referrals within a private practice setting. So as we were establishing our practice, we spent much of our time making phone calls, sending emails, visiting different assisted living and memory care facilities, doctors' offices, rehab centers, you name it. We were door to door. We were also fortunate to have connected with an established music therapist in our area. Some of you may know Becky Watson. And she referred us to several of the facilities that we work with today, and we're very fortunate and grateful for Becky. Most of our current referrals come from parents, loved ones, or caregivers who have sought out music therapy services and were able to find us online. As the only music therapy private practice in our immediate area, a quick Google search thankfully leads to our website and contact information. A lot of our referrals have also come from word of mouth or from current clients talking about the positive impact of music therapy amongst their friends and family groups. Music therapy can also be referred by a healthcare and educational professional, such as a doctor, teacher, psychologist, or social worker. There are currently a few states, for example, Arizona, Maryland, Indiana, Wisconsin, and Michigan, that allow for payment for music therapy services throughout the use of Medicaid home and community-based waivers for certain client groups. Unfortunately, Virginia is not one of those states yet, but we remain hopeful that with the state's licensure that was introduced in March of 2020, and application procedures are still being developed, but we remain hopeful that we will be able to reach even more people who could benefit from music therapy and who would otherwise go without if not for the ability to utilize health insurance. Thankfully, there are several grants available that can be applied to music therapy services, and some of our clients have had recent success in utilizing grants to pay for the services. Because most of our families pay out of pocket, we do offer payment plans and discounted rate options, and have also just recently established a scholarship fund for our clients that we hope will continue to grow in the coming years. We have started kind of selling different merchandise items to try and use all of those funds that we get from either selling t-shirts or different merchandise items. All of that goes into a scholarship fund that we then distribute to our clients to help ease the burden a little bit. Our client base, we wanted to get a little bit into some specific interventions and goals that we work with some of our clients. We're incredibly fortunate to have the privilege to work with such a diverse population of clients of all ages and from all walks of life. One of the benefits of working in private practice is that we have the opportunity to serve such a wide variety of clients. So I'd like to take a few minutes to share some examples of specific goals and interventions used in a few of the populations that we work with. We work a lot with older adults in either assisted living, memory care, or just skilled nursing care facilities. And music therapy can be an effective modality for older adults to help maintain and slow the regression of speech and language skills, maintain memory organization and thought processing, promote reality orientation, increase social engagement, and so much more. Some of the interventions that we might use in private practice within these facilities for older adults would be group music making or songwriting, singing familiar songs or hymns, or physical activity to music such as egg shakers or scarves. Within these populations, we experience a lot of clients who are suffering from dementia and Alzheimer's. And as that disease progresses, an individual may lose their ability to speak, but many people are still able to sing their favorite songs or hum. Specific music therapy interventions can also be designed to incorporate music and visuals such as clocks, calendars, and seasonal items to promote increased reality orientation. So depending on the season, on the time of year, if there are any specific holidays that are coming up, we might tailor our sessions to around those different kind of reality orienting themes to help boost that reality orientation within the group. Another population that we are privileged to work with is the autism spectrum disorder. Music therapy can help individuals on the autism spectrum identify and appropriately express their emotions, enhance auditory processing and other sensory motor, perceptual motor, gross and fine motor skills, and enable those without language to communicate, participate, and express themselves nonverbally. And very often music therapy also assists in the development of verbal communication, speech, and language skills. And I'd like to share a personal story at this time about one of my clients that I've been working with for just about 5 years since the practice started. He is a young boy on the autism spectrum. We started out primarily nonverbal, came into music therapy, and we immediately got to work on developing that speech and helping him to make those connections so that he could find his voice. And I'm happy to say that within the first year or two of us working together, he really started to just explode with language, different vocab words. He's singing and moving and laughing along to music, and is just a different kid than when we first started. So it's a story that's near and dear to my heart. He's somebody that's really just shown the power and the efficacy of music therapy just kind of right in front of me. So with the autism community, we might do things like fill in the blank songwriting, giving them an opportunity to insert their voice. So we might start a line of a song and then leave out the ending phrase or word and give the client an opportunity to input that word. We also do a lot of instrument play, using mallets in both hands, getting them to cross midline, reach up for different drums to tap, using their fingers to play piano or play the keyboard to work on those motor skills as well. Another client population that we have the privilege of working with is in a local cancer center in our region. A cancer diagnosis often disrupts social, physical, and emotional well-being and can result in a range of negative emotions, including, but not limited to, anger, fear, sadness, guilt, embarrassment, and shame. Music therapy can help to reduce physical and emotional stress, alleviate pain, ease treatment side effects, support immune system functioning, and enhance coping mechanisms. By connecting with others and participating in a meaningful activity, music therapy can alleviate feelings of isolation and loneliness. Group music making can promote positive, successful experiences while interacting with others, which can lead to increased self-esteem and foster self-expression and creativity. A few examples of some interventions that we might use within this population would be music-assisted relaxation, group music making, such as singing, moving to music, group songwriting, or lyric analysis. As we all know and experienced, COVID significantly impacted the way in which we interact with one another, and this was especially true for healthcare providers. A few months into establishing the practice, we, like so many others during that time, had to learn to navigate the virtual world of music therapy. What did we learn? That we can still find a sense of community through making music together in a shared space, even if that space is online. With that being said, I hope you all are nice and warmed up for the next portion of our presentation. Danielle will lead us in a mock music therapy experience where she will introduce you to an example of a music therapy intervention used in a private practice setting.
All right, so hello, I'm Danielle. Today you all are going to get to experience a little bit of fill in the blank songwriting. So this is an intervention that we use often with a number of different populations to address a variety of goal areas. It can be used to create a sense of community, encourage creativity, foster speech and expressive communication, address mental health topics, and more. Recently, we used this intervention that we'll be doing today at a local grief camp where we provided music therapy sessions to adults who had lost children and spouses and children who had lost parents and siblings. So that was a heavy experience, but the music was very powerful there. So it's something we wanted to share with you all. Our goals in utilizing this intervention and song in that setting were to foster a sense of community and to encourage discussion around the support systems that these clients had in their lives, which are one coping mechanism to help them manage their grief. So for the next 15 minutes or so, imagine you're coming to music therapy yourself. Today we're going to use the song Lean on Me by Bill Withers, so you might have heard it, to discuss the support systems that we all have in place in our lives. So we're going to start by singing through the original version of the song. It's going to be shortened a bit for time. And I know we won't be able to hear you, but please feel free to join in, sing along, move your body, play the table in front of you like a drum. Nobody can hear you or see you, so participate however feels good for you today. And there's some words missing here because we're going to fill them in later, but we're just going to go through the original version. So if you happen to know the words that go in there in the blanks, join me. Sometimes in our lives, we all have pain, we all have sorrow. But if we are wise, we know that there's always tomorrow. Lean on me when you're not strong, and I'll be your friend. I'll help you carry on. Oh, it won't be long till I'm gonna need somebody to lean on. If there is a load you have to bear that you can carry, I'm right off the road. I'll share your load if you just call me. You know me when you're not strong, and I'll be your friend. I'll help you carry on. Oh, it won't be long till I'm gonna need somebody to lean on. Yay. So thanks for participating if you did. I'm imagining that you're all singing along and joining and dancing. So at this point in the session, we would typically have sort of a group discussion about what the original song means, what it means to people as it is. And a question that I might pose would be, who are people in your life that you can lean on? So for time's sake, we're not going to share all of that today, but just think to yourself a little bit, who are the people that you can lean on in your life? Who or what are your support systems? So we would take some time to share those things. And then the next part of the session will be that over the next about 3 minutes or so, you're going to have some time to come up with your own words to fill in the blanks.
So I'm going to go ahead and play through the song a few times. I will hum the tune, but I'm not going to say any words. So this time is for you to think through the tune, imagine what words might fit in there for you. There's no right or wrong word. There's no direction that you shouldn't take the song. You don't have to worry about rhyming. This isn't about being professional musicians. Just add words that you feel would make the song interesting or personal to your life. So we'd love if you guys would go ahead and type your suggestions into the Q&A section. You might include a few of the words before or after your suggested word, or maybe even the whole line, just so we know where you think that word fits best. And as I'm playing through and you all are thinking and hopefully sharing, Megan's going to be taking some of those down. So yeah, get creative, and here we go. Nice. Getting some good stuff already. Stress, frustration, good. Worries, disappointments. Wow. Great words already. Can you scroll?
Keep them coming, guys. I see that you're answering. We're just trying to find your answer.
Yeah. We can see the first few. Oh. Huh. It doesn't scroll. 2 fingers scroll.
There we go.
We're seeing
Oh, you guys are awesome.
Heartache.
Heartache, strong.
Tired. Thank you. I'm gonna play through one more time and get your suggestions in if you have them. Great job. We all need somebody. Might have a problem that you understand. We all need somebody. All right.
Wow. Thank you all so much for those amazing responses. It
Yes.
really means so much to us to see everyone just blowing the Q&A chat up. And I apologize that I was having trouble trying to get all of the answers, but I think we have come up with your version that you all have come up with for Lean on Me. So
we're going to do your version. A couple things I want you to notice about this too. You'll notice at the top, there's a space that says edited by and blank. So in a session, we would typically put the name of the individual or the name of the group who created this to kind of provide more of a sense of ownership over the new version of the song. So this is you all's song, Benjamin Goldberg Foundation, Healing Arts and Medicine. You all have created this today.
yes.
I'm going to go through now, try out some of your suggestions in the song. And as before, feel free to join me however you are most comfortable. We're going to kick it up a notch here. Same song over and over.
Sometimes in our lives, we have disappointments, we all have stress, but we are resilient. We know that there's always tomorrow. Lean on me when you're not happy, and I'll be your emotional support animal. I'll help you carry on, for it won't be long till I'm gonna need somebody to lean on. If there is a person you have to deal with that you can't carry, I'm right up the road. I'll share your journey if you just call me.
Wow.
Give yourselves a round of applause for a beautiful arrangement of Lean on Me. And thank you again for just all of the amazing suggestions. If we had another verse, we would be able to fit all of them, but there were so many good ones. So
this is something you all can take if you're feeling really creative, which the Q&A looks like you were. Take this home and do it on your own with your own songs that matter to you. It can be good for us all. So we're going to show you one more slide really quick. We're running short on time, but here you can see some of the words that were suggested during our recent use of this intervention at the grief camp that I mentioned before. So I think we'll close by singing this version, and that way you have the filled in words there. So join us with a new version that was created recently by some of our actual clients.
yes, and I'd also like to point out that we have a commonality. And I'll share your journey.
Yeah.
So
you guys thought of that, and they did too. So
sing along with us.
What we have never heard was emotional support animal.
One of my
Speaking
favorites.
for me. Yeah,
yes,
that was great.
That
Lovely.
was a great.
Okay. All right.
Sometimes in our lives, we all have doubt, we all have darkness, but if we are brave, we know that there's always tomorrow. Lean on me, you're not okay, and I'll be your wing. I'll help you carry on, for it won't be long till I'm gonna need somebody to lean on. If there is a path you have to walk that you can travel, I'm right up the road. I'll share your journey if you just call me.
Thank you all so much. Thanks for having us today. Thanks for sharing your time on a Saturday morning and for trying what I imagine might be something new for at least some of you. So we're looking forward to talking more and answering some questions during the panel time.
Thank you.
Thank you so much, Danielle and Megan. That was so wonderful. I don't know about our audience, but I'm sure that others feel the same way just by looking at how everyone participated. But when you sang the song that we all put together, I started to tear up. So I was just so moved by it. So thank you so much for that. We are going to get ready to take a 15-minute break. But before we do that, I just have a couple of announcements. So first of all, we want to share with you, once again, thank you so much for spending this Saturday morning with us. We want to just share with you another event that we are putting on next month, March 14th. That is going to be an in-person event in Norfolk, Virginia, in honor of something called Social Prescribing Day. I'll share a little bit more about what social prescribing is towards the end of the conference this morning. But in honor of that, we will be doing a movie showing of American Symphony, which is a documentary about and by musician John Baptiste and his wife, who is also a musician and an artist. And this documentary follows their journey as they leaned into their creativity and the healing arts while she was undergoing treatments for leukemia. And that movie showing will be followed by a brief panel discussion as well. Additionally, while we are on break, we will put up a slide where you can find information about ways that you can stay connected with us. So we invite you to join our newsletter, to follow us on social media, to check out our Peace Out portal, which is a free resource center for articles about the healing arts, scientific based, that I write every month, as well as videos with guided practices. So we invite you to kind of use this as an opportunity to take a peek at some of those resources. In the chat, you will see the link to join our March 14th event. As I mentioned, we'll go ahead and take 15 minutes here. So we'll return at 10 a.m. So go ahead, grab a snack, stretch out. At 10 a.m., we will have a wonderful presentation by Dr. Sidel Ross. And then we will also have our panel discussion and Q&A. And I do want to also give a shout out to Jennifer Chapman, who you see this beautiful BGF logo on the screen here. You may or may not be seeing that, but we could not do any of this without Jennifer. She is working behind the scenes here for us, helping us get these slides, helping us bring up our panel speakers. So we could not do any of this without you. So I definitely wanted to give you a shout out as well, Jennifer, and we will see everyone back at 10 a.m. Welcome back, everyone. I hope you had a nice little break and were able to stretch out, maybe get a little snack or refill your coffee or tea. I am really excited now to introduce our next speaker, Dr. Sidel Ross. Dr. Sidel Ross is an anesthesiologist and pain medicine specialist who currently practices hospice and palliative medicine. Dr. Ross received her Doctor of Medicine degree from Columbia University's Vagelos College of Physicians and Surgeons. She completed her residency training in anesthesiology at New York Presbyterian Hospital, Columbia Medical Center. Dr. Ross completed her fellowship training in pain medicine at the Hospital of the University of Pennsylvania, and she currently practices in the New Jersey Veterans Affairs Healthcare System. Dr. Ross is also a classically trained, award-winning vocalist who uses the gift of music to care for her patients who are living with life-threatening or life-limiting illnesses. She is the host of a podcast entitled Prescriptions in Song, whose goal is to promote awareness of the healing potential of music. She features guests who have dedicated their lives to using music to care for others, and she highlights evidence from the medical literature that supports their work. Dr. Ross's work in music and medicine has been featured on various digital media platforms and radio programs, including ICVR Radio and Broad Radio Australia. Dr. Ross is a member of the Healing Arts Committee of the New Jersey Veterans Affairs Healthcare System. She's also a member of the Music and Medicine Committee of the American Medical Women's Association. Dr. Ross offers the gift of music on a voluntary basis to residents of healthcare facilities and underserved communities in the New York City metro area. Dr. Ross received an Arnold P. Gold Foundation's Humanism in Medicine Award for being recognized among physicians who are exemplars of compassionate patient care and who serve as role models, mentors, and leaders in medicine. Today, Dr. Ross will be speaking on the topic of the sound of comfort, music at the bedside in hospice and palliative medicine. Welcome, Dr. Ross.
Good morning, and thank you very much for having me. Can you hear me?
Yes, we can hear you great.
Wonderful. Okay, let me share my screen at this time. So, as we move forward, I have to, as an employee of the US federal government, I just need to make a statement indicating that my opinions or whatever, the ideas that I express in this presentation are not those of the US government. And I also have no financial conflicts of interest to disclose. So what are we going to be doing today? What am I going to be talking about? As I start my presentation, I will spend just a brief amount of time highlighting the differences between music therapy and music medicine. I also want to spend a little bit of time looking at the distinction between palliative medicine and hospice medicine. Then I will move into a historical review of music for healing purposes, and take some time to discuss the shift away from person-centered care that took place in the late 18th and early 19th centuries that kind of paved the way for our modern healthcare system. I will reflect on my own journey with a brief discussion of burnout syndrome that I experienced. And then I will shift gears and share some of my experiences with patients and families involving music and the role that music has played in these encounters. Music has helped to create connection with patients. Music has helped to affirm personhood and build legacy for patients. And it has also offered spiritual support, not to mention it has basically restored joy in my own practice. And as I highlight some of these interactions and the role that music has played in these interactions, I will also be discussing some of the relevant medical literature that lends support to these observations and experiences that I've been privileged to have. Okay. So, as a hospice and palliative medicine physician, I try to take every opportunity that I can to provide some education on what hospice medicine and palliative medicine are. And this is important because I think there's a lot of miscommunication, misinformation, even among healthcare providers. All too often, the words palliative and hospice are used interchangeably, but they are not the same thing. As the slide illustrates, palliative medicine is available to anyone at any stage of a life-threatening or life-limiting illness. So that means it can be given along with curative treatment. What we do in palliative medicine, one of the main things that we do is manage symptoms, any distressing symptoms that may be caused by the life-limiting or life-threatening illness, such as pain, anxiety, and in particular, depression, spiritual, and existential distress. We also have a lot of conversation about the goals of care, meaning what are we hoping to achieve as this person continues to live with their illness and continues to receive care for their illness? How do we essentially customize a treatment plan that ensures that at every step along the way, we are providing the patient with the care that is in keeping with their own goals and values? So again, as the slide illustrates, all this is happening while life-prolonging treatments are underway. Once we get to, on the other hand, sometimes, some of my patients do well with their treatment and I never see them again. Or sometimes they check in with me from time to time just so that I can ensure that they're doing okay and they still have a good quality of life. Sometimes, unfortunately, the disease runs its course, but treatment therapies have not been effective. The expected outcome or the desired outcome is not in fact what came to pass. And so sometimes the transition is made to hospice medicine. And it is at this point that we say, you know what, when someone is now eligible for hospice care, they have a life expectancy on average of about 6 months or less if the disease process runs its expected course. And so this is what hospice is. This is really the time at which we begin to prepare for end of life care. And so I like to think of hospice medicine as palliative care, specifically for the end of life. I hope that clears up any confusion that anyone may have had. We heard about what music therapists do, who they are. Music therapy is the clinical and evidence-based use of music interventions to accomplish goals within a therapeutic relationship, and it is offered by a credentialed professional who has completed an approved program. What I do is more generally referred to as music medicine. So in music medicine, music and music-based interventions are used during the course of caring for patients. I want to say that I recognize that what I am doing is nothing new. In fact, for centuries, music has played an integral role in the healing process. If we look at ancient Egyptian illustrations of healing ceremonies, we see musical instruments prominently featured here. In this example, we see the lute, L-U-T-E, the short-necked version, as well as the long-necked version. In the Bible, we learn of King David, who would play the harp for Saul. And in the book of Samuel, it's written that it came about that whenever the dark spirit fell upon Saul, David would take his harp and play it with his hand. So Saul would be refreshed and be well, and the dark spirit would leave him. Again, moving further along in history, during the Ottoman Empire, there's an illustration of a hospital that was built in the 13th century in Cairo. And we're told that within a spacious quadrangular, this enclosure of 4 buildings arose around a courtyard fully adorned with arcades and cooled with fountains and brooks. And it may be a bit difficult to appreciate from the illustration here on the slide, but what we see are these men seated around the fountain with musical instruments in hand, and they're attending to hospitalized patients. Okay, so here is when things start to change. In the early 18th century, with the birth of the clinic, a new model was developed, one that called for a different approach to providing care. And instead of incorporating the patient's narrative or story into the healing process, this new model required a more distant gaze, so to speak, which basically reduced patient information to the smallest number of facts and to the plainest amount of data that could be analyzed. So really in this new paradigm, there was not much room for discussion of a patient's lived experiences, because in order to make things more concrete, so to speak, for the purpose of rigorous scientific analysis, objectivity really became the focus. And so essentially the healer became primarily concerned with what was concrete, what they could see, what they could touch, what they could hear, what they could measure, and so that this information could be used for further analysis and study. And it is this really kind of reductive approach to engaging with people and caring for people that paved the way for the modern, for the foundation of modern medicine. And so we fast forward some 200 years later or so, and this is the system in which I find myself. And the slide is entitled The Origin of My Journey, but it really could aptly be titled The Origin of My Discontent. Because as I continued to care for patients in this paradigm, I became increasingly unhappy for some of the reasons listed here. One of the main things that contributed to my disenchantment was the limitations in available treatment options for symptom management. Many of the prescribed medications, that we would traditionally use and rely on in our medical system, really were not that effective. And if they were, they were at best somewhat helpful, but they were also met with all of these side effects. Patients could no longer use them. I would spend hours fighting with insurance companies, trying to make a case for my patient, advocating for them so that they could provide coverage for certain medications that could potentially be of benefit. Astronomical cost in medication was another barrier to achieving goals. And it just became exhausting. And one of the things that I think really was the most kind of heartbreaking part of all of this was the fact that I felt that I had absolutely nothing to offer patients who would be sitting right in front of me in the throes of existential distress, loss of personhood and loneliness, and the feeling of helplessness just became overwhelming. So this eventually led to frustration, which over time led to feelings of helplessness and lack of purpose. And I didn't know it at the time, but I was burnt out. I had developed burnout syndrome. And this is a long-term stress reaction that's characterized by emotional exhaustion, depersonalization, so lack of empathy for patients, and even negative attitudes towards them, and feelings of decreased personal achievement. Like that was the biggest one for me, feeling that I had really had no purpose. I didn't serve a purpose. And as you can see in the PubMed illustration, burnout was not something that was readily discussed up until the last few years ago, and it really did peak during the time of the pandemic. I also want to make the point that burnout is a condition that affects all specialties and all practice settings, and so none of us is really exempt. So we really have to take stock of this and find ways to guard against it. Back. Okay. So researchers suggest that engaging in meaningful activities may actually protect against burnout syndrome. And in this paper, the authors encourage healthcare providers to take an active role in connecting meaning to the work that they do and to find ways of kind of injecting meaning and purpose into their work. And so for me, knowing that music had always been a great source of joy in my life, I came up with the idea of offering music, the gift of music, to my patients. And I wanted to see if it could offer them some measure of comfort and joy, as it had always done for me, while at the same time perhaps restoring the joy that I lost in my profession. And this is how the experiment began. Was a 59-year-old veteran with stage 4 prostate cancer who had come in because he could no longer move his arms and legs. The prostate cancer had become so advanced that it had spread to his spine, his cervical spine, and also invaded the spinal canal and was compressing on his spinal cord. So he could no longer use his arms or legs. And he was angry, just angry at everyone, constantly lashing out. We were called to assist with symptom management and to help establish his goals of care. And before we went in, we were told by the medical students, the residents, the nurses, be careful because he's cursing at everybody and he's probably going to kick you out. So just be prepared. Now, I suspect that he was in the Kubler-Ross stage of anger at the time that he presented. Elizabeth Kubler-Ross was a psychiatrist and pioneer in the psychology of death and dying, and she identified these 5 stages of grief that people tend to go through when they're living with a life-limiting, incurable illness. And so, as I said, I suspected that he was at the anger stage. So I went in and introduced myself. The eye contact was minimal, excuse me. Very closed, not limited engagement. But he didn't kick me out. And I kept asking very simple questions to which he would give me very simple answers, one-word responses. And then we got to the psychosocial assessment, which is really the part of the encounter that I tend to focus a lot on because that really gives me a sense of who people are. And I had asked him about the things that he has always enjoyed in his life, and music happened to be one of them. I asked, well, who's one of your favorite kind of vocalists or artists? And he said to me, Luther Vandross. And I said, well, that's wonderful because he's also one of mine. And I said, in fact, one of his songs is really special to me because that particular song is the song that I danced to with my father for my wedding. And he said, huh. I said, in fact, would you like me to sing it for you? He was like, what do you mean? You're gonna sing here? I said, yeah, I can if that's okay. And he was like, all right, I guess you can go ahead. So it was back when I was a child, before life removed all of the innocence. My father would lift me high and dance with my mother and me, and then spin me around till I fell asleep. Then up the stairs he would carry me, and I knew for sure I was loved. If I could have one final dance, another walk, another chance with him, I'd play a song that would never, never end. How I'd love, love, love to dance with my father again. And as I was singing, I saw the tears starting to stream down his cheek. And it was as if a brick wall had suddenly crumbled. And then he says, I miss him so much. I'm like, who's him? He's like, my own dad, my own father. And he went on to talk about their relationship and things that he had enjoyed, experiences that they shared. And from that moment on, our relationship was different. He did ask me to leave the room at that time because he just wanted to be alone with his thoughts and the memories of his dad. But he did ask me to come back the next day and the day after. And as often as time would permit, I would go to the bedside and we would share songs and experiences until the day that he passed away. And so clearly, music was the tool that was necessary here to kind of open the doors of communication. Music was the key. And I wanted to find out if other people in the, other researchers, other clinicians have had similar experiences with the use of music. And so I found an article here that was written by a psychotherapist in 2020, the American Journal of Psychoanalysis. And she writes of an experience with a patient named Paul. She says, Paul was here. I thought of my struggles with Paul. I experienced him as cold and distant, and I could not reach him emotionally. I frequently felt empty and at times angry, but I could not move him from his defensive stance. I wondered if there was something that I was not saying that could reach him emotionally. He spoke in a monotone voice, no matter what the topic was. He didn't express emotions, even though at times I expected those feelings to appear. At that time, I didn't know how Paul experienced me, but I had heard a rigidity and a distance in him. That first time that Paul talked about music was a very special moment for me. I began to feel connected to him and heard him in a different key. His tone was softer but alive, which allowed me to bond with him in a different way. It felt like an invitation to go inside, to pass through a door that had been closed before. In another encounter, I had a 90-year-old veteran, excuse me, with mild to moderate dementia and rectal cancer. He was a professional jazz musician and actually quite accomplished. In speaking with him, I learned that he had toured with some of the legendary jazz musicians of our time, like Dizzy Gillespie, and wrote songs for many artists. Had really had an illustrious career. But unfortunately, with dementia and the rectal cancer, began to suffer progressive functional and cognitive decline. His family had said that it had seemed like he really lost his sense of purpose. And we were, again, asked to come and assist in his care for management of symptoms, kind of the goals of care, and also to provide supportive counseling, just to assist him and his loved ones, his family, kind of cope with what was happening, with the reality of the situation. And knowing that he was a professional musician, from the very first time that I met him, that was how we connected. And I remember our first encounter, it was a rainy day. And as we were talking, I said to him, I suspect it's raining, and it makes me think of a song, which I suspect Here's That Rainy Day. And he says, da 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 da. And I say, yeah, funny, but here's that rainy day. Here's that rainy day they told me about. And I laughed that it might turn out this way. Where is that worn out wish that I threw aside after it brought my lover near? Funny how love becomes a cold, rainy day. Funny that rainy day is here. we continued to share music. I would sing with him, he would sing with me. There were times when he might have been too weak to sing, but he always welcomed music. And in fact, he had shared with me that one of his wishes would be to have a bedside jam session before he dies. And so I set out on the mission to accomplish that, to fulfill that wish. One Saturday afternoon, I got some friends together, 2 saxophonists and a trumpeter. And I, of course, also went as the vocalist. By this time, he had moved to the other campus where the hospice unit is located, because we had established that there was no more disease-directed treatment that we could offer for the cancer. And so the decision was made to transition to hospice care and prepare for end of life. So he was transferred to the hospice unit, which is about 30 minutes away from where I had met him in the acute care facility. It was a Saturday. I was not on duty. But before we even set out to go there, I called ahead to make sure that he was still alive. And the nurse said to me, well, if you're going to come, you should come now, like today, because it's unclear if he may be here tomorrow. Okay. So we all got together. We got down there. As I get there, I still kind of wanted to assess him to be sure that he was still alive, or at least could still kind of interact or engage in some way. I saw that his chest wall was moving, so he was still technically alive, but he was lying there motionless. I could kind of see him moving at times, kind of moving his head slightly in the bed. But then as my friends began to warm up with their instruments, his eyes open, and I hear him reaching for someone to pick my head up, just pick my head up. What's going on here? And he becomes a different person. They start playing, I start singing, and he comes alive. We took a little break, and he calls my friends over to the bedside, and he says, come, let me share a few things with you. And he was basically acting as a mentor, right? This person who had seemingly lost his sense of purpose, lost his personhood, literally regained all of that. And it was just fascinating to watch. And I say to this day that it was one of the most successful resuscitation attempts that I had ever witnessed. So in the literature, music therapists and chaplains talk about this experience with music that they themselves witnessed in patients with dementia. This article was published in the Journal of Dementia in 2021. And they say that music can offer people the chance to be themselves again. It's important to validate people with dementia as individuals who have their own interests. And people with dementia are sometimes treated as though they've forgotten everything, but the music can help them focus on what they can actually do. In this encounter, I had the privilege of working with a pastor, 68-year-old pastor who ministered to at-risk youth on the streets of Newark, Irvington. Areas that are considered under-resourced. He had developed stage 4 lung cancer that had spread to his cervical spine. So by the time I had met him, he had very limited mobility of his arms and legs. He was bedbound. And he was in a lot of pain. Also felt very isolated because he could no longer be out in the community doing the work that he felt he was called to do. And as we continued to talk, and he told me more about the work that he had been doing in the community, basically saving lives. We discussed his life story and the legacy, which really began to provide him with a significant amount of relief, certainly from the physical pain that he was experiencing, and perhaps from the existential pain that he was also experiencing, and the the loss of personhood, the grief that he would have been experiencing at that time, because he was no longer the person that he felt he was no longer the person he once was. And so in that moment, I thought that it was important to remind him of the legacy that he created. And as we talked, I said, there's a song that really, in my mind, helps to solidify and establish who you are and what you've done in your community. And it goes like this. And I shared this with him. If I could help somebody as I pass along, if I can cheer somebody with a word or song, if I can show somebody he is traveling wrong, then my living will not be in vain. Then my living will not be in vain. Then my living will not be in vain. If I can help somebody as I pass along, then my living will not be in vain. It's important to note that that is a song that is often used in places of worship. And again, I thought would have been appropriate in that particular setting, knowing that he was a pastor. But it brings to mind another kind of question that I'd like for us to consider, and that is this idea of the clinician providing spiritual support or even religious support. When I was in training, that was something that we were actually told implicitly, but sometimes even explicitly, that was not our place, that was not our role. We shouldn't be exploring that with patients. And if those issues were to arise, we were to just ask for a consultation from a chaplain. But again, in sitting with patients and in witnessing the distress, to me, just referring them to a chaplain was perhaps not ideal, especially if they were in the throes of distress and in the midst of agony. I wanted to be able to help. And so this article, Doctor, Will You Pray With Me, kind of offers some food for thought. The author of this article kind of makes the case that perhaps in our training as healthcare providers, there should be some emphasis or some focus on providing us with tools for identifying these needs, responding to and appropriately responding to patients' requests for spiritual and or religious support. And so I'd like to see how this unfolds as this movement continues, and there's a greater awareness for the need for these kinds of interventions. In the article discussing life story, forgiveness, heritage, and legacy with patients with life-limiting illnesses, the authors are calling for a greater understanding of patients' needs and new approaches to care. They make the case that the life review is important because it offers ways to find meaning, realize worth, and gives patients the opportunity, and loved ones as well, the opportunity to leave a legacy by affirming who they are, focusing on their accomplishments and future goals. Sometimes conflicts and regrets are brought up, they come to the surface of discussions and can really be powerful in facilitating reconciliation and restoration of relationships at the end of life in particular. And so at this time, as I come to the end of my presentation, I'd like to share with you a song that I have often shared with my patients and their loved ones at the bedside. It is entitled, "This Song Is You." And it is a gift that I offer to all of you here. And I hope that you will take it with you. And I hope it will continue to stay with you for quite some time to come. I hope you can hear it. Please let me know if you cannot. I hear music when I look at you, a beautiful theme of every dream I ever knew. Down deep in my heart, I hear it play. I feel it start, then melt away. I hear music when I touch your hand, beautiful melody from an enchanted land. Down deep in my heart, I hear it say, is this the day? Oh, I alone have heard this lovely strain. I alone have heard this glad refrain. Must it be forever inside of me? Why can't I let it go? Why can't I let you know? Why can't I let you know the song my heart would sing? That beautiful rhapsody of love and youth and spring. The music is sweet, the words are true. This song is you. Ba do ba do ba ska ba di bi da. Zuba do ba do ba. Zuba do ba do ba. Zuba do ba ye. Zuba do ba ska ba do ba. Da ba di bi ba do ba do blia diddlia do bli da. Zuba do ba zuba da do ba da ba zuba do ba da. Zuba do ba da ba. Zuba do ba da di. Zuba do ba ye. Strain. I alone have heard this glad refrain. Must it be forever inside of me? Why can't I let it go? Why can't I let you know? Why can't I let you know the song my heart would sing? That beautiful rhapsody of love and youth and spring. The music is sweet, the words are true. This song is you. This song is you. Thank you for your attention.
So beautiful. Thank you so much for sharing, Dr. Ross. And I do want to share a few of the comments that came in throughout your presentation of just, so powerful. Dr. Ross, thank you for sharing these stories in your presentations. And one participant wrote that some of the most powerful moments I've had as a physician was when a patient asked me to pray with them. So thank you so much. Also noted, this is so true, how music can connect people and make them feel less alone. So thank you so much for sharing. And you may have noticed, if you could, Dr. Ross, stop your slide share for us, your screen share. We are going to get ready to move into the panel discussion now. So you will have noticed that we have brought up all of our speakers here. So our speakers, you can go ahead and turn your videos back on for us as we head into our panel discussion and Q&A. And so I would like to go ahead and start off with, and so as we're moving into this section, for all of our attendees and participants, please, if you have not already submitted any questions that you have, please feel free to submit them in the Q&A section, and we will start going through them, as well as some questions that I have prepared as well for our panelists. But I think I would like to go ahead and start with some of the questions that came in through our attendees so far. So one of the first questions we got is, how do I go about referring pediatric patients specifically for music therapy in the Tidewater area? So I do believe that a couple of our presentations have touched on this, with Chris speaking about inpatient and Danielle and Megan speaking about outpatient, but maybe we can just touch on that again briefly for whoever feels comfortable taking that question. So how do I go about referring pediatric patients specifically for music therapy in the Tidewater area?
I guess I could speak a little bit about it. Um, I only work in the hospital. Like I only see inpatient. So if um we've had what's the word? Pre-visits for patients who have planned admissions. So if they come in and whoever's doing the tour, refers them to me, and they say, I think it would be a good idea for them to, have music therapy services. Here's what they could benefit from. Then I can make it a point to see them whenever they are admitted. But that's like only if they're inpatient. That's how I can see them.
And we can speak a little bit towards the referrals with the private practice or the outpatient setting. A lot of those that we had mentioned as far as kind of either self-referral or a parent referral, a doctor or a pediatrician can also refer to services. And so, yeah, from an outpatient perspective, we really rely a lot on those either self-referrals or referrals from other caregivers or educational or healthcare professionals.
Great. And then along those same lines, there was another question of approximately how much does a session cost for music therapy, especially since most insurances don't cover it. And I know, Megan and Danielle, that you both shared some I was very impressed by a lot of resources that you as a practice have made available, such as the scholarship fund, to be able to make these services as accessible as possible. And I think that's really wonderful. But the question is, how much typically does a session cost? And since insurances don't cover it, and I know specifically the person who's asking this question is based out of California, so her patients may not be able to access the resources that you as a private, specifically Tidewater Music Therapy, have been able to provide. So any available resources for underserved patients, maybe in other parts of the country, who they can, get access to these services.
Yeah, so it's actually really variable depending on the situation. So our prices are kind of based on frequency of sessions. They also change whether the client is coming to see us in office or if we're traveling to their home. Starting price, kind of a base rate, is around $90 per session. So it can go up and down from there depending on if you do a package of sessions or if we're seeing you in home, things like that. We do also offer virtual sessions. So if you wanted to refer clients directly to us, we've done this kind of work basically since COVID, like we all have. So it can definitely work. It works best for adolescents and above, but we've also made it work for children too. So yeah, you can refer people to us from afar if you think that would be appropriate. And that's kind of a general, starting point for the prices. But like I said, it changes depending on circumstance, situation, and how everyone's being able to pay for it. So.
And we also really try to, as a practice, try to work with families and clients to make sure that we're not extending them, but that they're also getting the services that they need, but that we are also, being recognized as an evidence-based practice, that, the services do have the value that we set them up for. So, but yeah, we do, like with the scholarship fund and the payment plans and things like that, because we do understand that it is expensive, and it's, not something that everyone can afford out of pocket. So we do our best as a private practice, but also a small business, to make sure that we're supporting our community and making sure that everyone who is able to access it can.
Wonderful, wonderful. And so just a brief follow-up question there. So you said that you do see clients and patients virtually as well. And so I believe you did mention this in your presentation as well, but as of this time right now with music therapy, there's no sort of statewide, like you can only see people in your state. So you can see people virtually from different states across the US, correct?
You can, and what our role would be as the music therapist would be to make sure, or just to look up the licensure requirements per each state, and just make sure that we're abiding by whatever that state's licensure protocol is. And as long as we are, then we are permitted to, hold the music therapy while we're in Virginia, but virtually from another state, as long as we're able to meet those licensure requirements for that state.
Wonderful, wonderful. Thank you so much. That is very helpful to know. Another question from an attendee is, what are suggestions on how to incorporate music therapy in primary care outpatient settings? This is coming from a physician. So specifically, perhaps if Dr. Meyer, Dr. Ross could address this, how to incorporate music therapy in a primary care outpatient setting.
I haven't seen, in my experience might be limited, I haven't seen where a music therapist would be like immediately like available working in a primary care setting. I think that would be somewhat unusual, but not unheard of. I mean, I think, I know psychiatrists often are integrated into, so we have at CHKD we have a GAP clinic. It's General Academic Pediatrics, centered in the children's pavilion, the new building. So that's an interesting, having brought that up, that's an interesting sort of way to maybe integrate, because we do have music therapy in the children's pavilion that works with the inpatient psychiatric admission. So perhaps a music therapist could work with the kids and the primary care kids in the GAP clinic. So I don't have it. I'm sorry to say I don't have experience, but that would be an interesting idea for the to develop, actually.
I agree. I think so. One of the things that I'm trying to work on, both on the inpatient and the outpatient kind of side of our system, is actually when we're doing an intake, when we're first meeting patients and getting to know who they are, kind of adding this idea of this question of, would music be of interest to you, or music-based interventions, just off the bat, so that if that is in fact something that someone might be interested in, and they hope to benefit from such a service, we could make arrangements then with perhaps getting our physical therapist to then meet with the person on a subsequent visit, or while they're still there, before they actually leave, if possible. It may take some coordination, right? If there is in fact a music therapist even available. If it's kind of more of if it's outpatient, kind of standalone clinic, that may take a little bit more coordination and research to find a music therapist who may be able to come and offer services there. But if it's kind of an outpatient setting that's more attached to a larger hospital system where there may already be a music therapist on staff, then you may have an easier time kind of integrating those services with the outpatient population, just kind of by identifying which patients may be interested, and then working with the music therapist to kind of create an opportunity or a time to meet with these patients so that we can make this happen. Because I think, and I thank you for raising that question, because part of what I hope to do and part of what I've actually begun doing is trying to really empower people to advocate for themselves in their care and in their wellness. And if there are other modalities that can help to engage people and make them and empower them to actually speak for themselves and kind of advocate for their own wellness, then I think that they should be exposed to these modalities and kind of given the option to really explore this. And the only way for that to really happen is for us in the system to expose them, and to provide them with the information and the experiences and the opportunities. So I'd be interested to actually communicate with that person just to kind of further explore this idea and develop this.
I agree. Thank you so much for those insights, Dr. Meyer and Dr. Ross. And I agree. I often say, I think especially in our modern day and age, just the way our healthcare system has adapted, the way in the ways that Dr. Ross reviewed the history of our healthcare system and the paradigm of practicing medicine over the years, that patients really do need to be active advocates for their own well-being as well. Unfortunately, just the way the healthcare system has evolved, whereas as physicians, as healthcare providers, our time unfortunately is very limited, and it's not by our own choice. As Dr. Ross brought a lot of wonderful points in her presentation, exemplifying some of the issues that we have as medical professionals and physicians in terms of providing care. One of the things that you had mentioned in your presentation with the history, that medicine became distanced from other realms of human experience. And I think, that brings to light, and when I heard you say that, that brought to light to me some of part of our mission here at the foundation of empowering children, families, patients, and caregivers, meaning family caregivers as well as medical providers, caregivers, realizing that we need all of these pieces in the healing journey. Something that was once there in the practice of medicine a long time ago, but simply through the evolution of the healthcare system has changed, and we hope to bring that back, right? And so often people talk about, and in the work that we're doing here at the Benjamin Goldberg Foundation, was talking about the healing arts and integrative therapies as something new, when actually what it is it's bringing to light the way that medicine was and healing was always practiced. And especially when we think about cultures and traditions, native traditions, Chris brought up an example, Dr. Ross spoke to this as well, in just the history in all native traditions, native healing traditions. This was just part of it. And as physicians and as healers, we knew about the, sorry, I'm going on my soapbox here right now as the medical advisor, but as physicians, as healers, we knew the entire human perspective of our patients. We knew what their hobbies were. We knew what their interests were. We knew, what their support systems looked like. And unfortunately, with our current model of healthcare, we simply are not able to go into all of that. And that's why it really takes a village of everyone within the healthcare system, everyone who's supporting the healthcare system, patients and family members being advocates, active advocates. And so I definitely encourage that as well. There was another question that came up in the Q&A section. This one is directly for Danielle, Megan, and Chris. coming from a hospice music therapist based out of Chicago who serves adult and pediatric patients, originally from the DMV. I grew up in the DMV, and also a proud alumni of Norfolk State and Hampton Roads Tidewater. Yes. So have you all, Danielle, Megan, and Chris, ever considered doing education and services for the music programs in high schools and local universities?
Yeah, so actually, when we first started our private practice, we reached out to all our alma mater, which is Christopher Newport University, and just wanted to start that conversation and get that conversation going as far as bringing education to their students. And also, we framed it as almost like group sessions where we could do stress relief or social interaction, just different types of ways to engage the students with music. So we definitely have offered that in the past, and I think that's a great way to expand the education into the community, especially in the school systems. We've been fortunate to have some colleagues that are currently teachers, and they've invited us into their either middle school or high school to do a brief presentation on what music therapy is and how do you get started in the field. And it's been really rewarding to learn and hear from those students who had never heard of the field before, but loved music and were really then afterwards considering that as something that they'd like to pursue. So yeah, I think that that's a great way to engage the community, engage the young adults who are getting ready to go out into the world and decide what they want to be. And we've been fortunate to be able to have a couple of those experiences in some different school settings, whether it's middle, high, or even in the college setting.
I've done some like only on like the individual level. During peak COVID times, the integrative care team um, sort of advised against going out into the community at that time, at least. Um, but I've had students around Hampton Roads email me to like interview me for your senior projects or whatever, and ask, "Hey, what's music therapy? What's this all about? How do I get into it?" So that's like sort of an informal interview process, and that's how I have talked about music therapy with our students. And I also went to before ECU, I graduated from ODU. I minored in music performance there, but they don't have a music therapy program. I think that'd be a cool thing to potentially get started, get talking about it at least.
Yeah,
Wow.
similar to CNU, they don't. They also don't have a music therapy program. I think in Virginia we've got Shenandoah and maybe Radford, I think has a music therapy program. So yeah, we've got a lot of work to do still when it comes to advocating for the field and getting it into more of our local universities so that students have an opportunity to study that if they choose to. I also just wanted to say that I think one of our favorite parts of being in private practice is, like Chris was saying, when people will reach out, students will reach out, and they just want to know about the field. They want to know how we got into it, and we love to spend our time doing that, just providing ourselves, being available to be a resource for these students who are just taking it all in. And it kind of takes us back to when we were students and studying and doing practicums and clinical hours. And so we love to kind of give back and hopefully inspire some of the younger generation to join the field.
And I find it extremely important too, having not discovered music therapy as a field until I was in university myself, which I grew up a musician. I went to high school specifically for music. So to get, to 20 years old without having heard of it is a bit of a shame. So I feel like it's a really important work to really kind of put it out, especially in the high schools, and make sure people know about it.
I agree completely. And an interesting point that was brought up with, perhaps a music therapy program being developed at ODU, and especially with, for those of you who are local in the Hampton Roads area, with this merger coming into play this year between EVMS and ODU. So that could be something really interesting and exciting for our area. Let's see, some other really great questions coming through here. Dr. Ross, in your interdisciplinary meetings, do you make it a point to have the interdisciplinary team acknowledge or honor the deaths of patients when reviewing the deaths and use music, such as bells or chimes, after a moment of silence?
So we do take a moment to certainly acknowledge and honor the deaths of our patients for whom we cared, but we have not kind of explored the use of music in that particular kind of space. And so thank you for that suggestion, because that is something that I will be happy to take back to my team. And I'm almost willing to bet that it will be embraced. And we don't have a music therapist in our hospital system. We had, he has moved on. And so it's because it is near and dear to me, I take on this work, and I am proud and happy to do it. And so I'd like to kind of talk a little bit more about how I could perhaps start doing that with the chimes and the bells. So if anyone has an idea, a suggestion, please share. If somebody already has a practice, kind of a best practice, kind of established for this specific purpose, please share.
Well, if I could, when we went to the grief camp, and they do some kind of a closing ceremony at the end, and they do incorporate a bell. And I believe that they rang it once for every name or every person who had passed. And it was kind of just like this moment of silence towards the end of the camp that we were honoring those who had passed, and they did utilize that bell just to ring for each of the individuals. So that's a way that it can be done, but I think there's ways to be creative and make it unique to your facility too. But I think that's a great idea and a great question posed.
Thank you.
Yeah, absolutely.
I have also heard of chimes or bells being used to represent different numbers. So years lived, years in a profession, important numbers to the patient's life. So that could be another way to incorporate that.
Thank you very much.
Thank you, everyone, for that. Another question that came through, can you touch on the evidence-based aspects of using different frequencies in music? That is open to anyone.
I don't know if our music therapists can respond. I just very briefly, I've been engaged in some of the work that is being done now by the Sound Health Network. I don't know how many of you may be familiar with that organization. And this is one of the areas that they are actively looking at. There's active research happening in this specific area, looking at how we might use different frequencies of music to create a different kind of outcome, kind of physiologic outcome. And so stay tuned. There's a lot more information coming.
I was interested in whether this pertained to frequencies as far as like pitches or different keys.
Different hertz frequencies.
Or perhaps I was trying to understand the question, whether it was pertaining to how often music therapy is offered or enacted, or whether that, when I hear frequency, I think of pitch or different keys or different chords.
I think we know there's definitely a lot of research out there. Maybe I shouldn't say a lot. There is definitely research out there about different pitches and different combinations of pitches, different frequencies affecting the brain or the body in a lot of different ways. I think in some ways that is bridging the gap into a little bit of more like sound healing work, which is not exactly what we do. Our focus as music therapists is on the music, the client, and the relationship that we have that comes through that music and the client or patient. So we're kind of really focused on the relationship and the music and how those things can work together to heal. there is definite benefit in music itself doing the healing. And we loved that quote that you shared in the beginning. It's about being present and being authentic and allowing the music to do its job. So we recognize that the music itself, the frequencies, are doing the work, but that specific research isn't really where our work takes place, if that makes sense.
Yeah.
I don't know if that was clear.
And I think kind of Chris touched on this about how sometimes music can be actually not recommended or kind of contraindicated. And I think that kind of is a discussion that can be had about different frequencies, right? And how those affect a patient. And so I think being mindful of what frequencies you're using with the patient and kind of knowing their reactions or seeing how they're responding to that, because it could be instead of being a therapeutic thing, it could be harmful, or it could be too loud or too high, or so I think that that's another kind of point along that discussion of kind of how frequencies play into the work that we do. So it's definitely a great question and a great thing to kind of think about and be aware of.
It also, I think, in our NICU training was probably the closest to it really being important to pay attention exactly, which range of pitches you're using, volume level, things like that. So that's a more medical setting, closer to like what Chris does. So it's, different patients, different clients, different situations. It's going to matter more. But yeah, great question.
I think those are very interesting points that you brought up, and it was very clear to me. And just I'm kind of thinking about it from my perspective. A little bit of my background is that I am a mind-body practitioner, certified yoga instructor, meditation instructor, Ayurveda consultant, and we talk about, we do a bit of sound healing. And so for me, from my perspective, it was very interesting to hear you speak about that difference between music therapy, really focus on that therapeutic relationship, and with that music, and then kind of sound healing, what I think about sort of in that mind body space of, crystal singing bowls, that sort of thing, that are at different frequencies and that we use. And I think that you brought up a really interesting point that I actually had not thought of before, which is interesting for me because I have a strong interest in trauma-informed care as well. But what you mentioned about some of those different frequencies and what Chris had mentioned in his presentation of contraindications, just thinking about some of those different frequencies, if those are working at different levels, that may potentially trigger some trauma responses, and being really cognizant of that. So I appreciate those responses. We have a number. I'm so excited for, thank you so much for everyone who is attending and all the questions that you're putting in the chat box. So I am going to, again, for time's sake, to make sure we can address as many questions as possible. And we will keep this, closing remarks are going to be short. So we will make sure that we address as many questions as we can, and also at the same time, be respectful of your time and wrap up by noon. So another question here, let's see. Do you have to limit what type of music is used to not disturb the healthcare environment? So this is a really interesting question because, those of you may or may not know, but we have the PSAP portal. I mentioned it during the break. And as part of that, I review the scientific literature and I write a blog article every month. And so I was just this week working on the next article, which had to do with art and music in short stay medical surgical units, and the effect that it has on nurses and nursing staff. And so this was something that kind of came up in my review of that literature, where in that study, and stay tuned for the blog article that we'll publish in the next week or two. But in that study, the majority of nursing staff on that unit found the music and arts interventions to be a very positive effect. But 2 of the 31 nurses that were in that study did report that they felt it was actually a negative distraction, and that they were, although no patient care errors were made in that during the period of that study, those 2 nurses specifically expressed concerns of that. So an interesting question. I'd love to hear what our panelists have to say about that. Just to repeat the question, do you have to limit what type of music is used to not disturb the healthcare environment?
As far as as long as I've been at CHQ, I've done all types of music. Sometimes the patients will recommend like types of music that I've never even heard of. They tell me stuff that I've never seen before. But it's tricky sometimes in the PICU because not every door closes. Sometimes your door is just a curtain, and you have to be like really aware of um, how the patient or you're playing the music can affect the patients around them. Like if you have a 2-year-old who really likes hitting this drum with a stick as loud as he can, I'm like, all right, I have to take it down just a little bit because we have like a sleeping baby who is only separated by a curtain. Whereas like on the floors, like every door is like with the exception of shared rooms, they have their own space. And if you close the door, generally you're good to go. Um, yeah, that's what I have to say about that.
I think we've definitely had experience with those kind of not so much pushback, but just kind of concerns about the volume or concerns about if it's affecting other patients. Specifically, when we did our NICU training, which was in Tallahassee Memorial, they kind of spoke on some of the pushback they get from some of the nursing staff as far as like, is this going to disturb other patients? Is this something that is the benefits outweigh the any kind of negative connotations that might come along with it? And I think we as music therapists just continue to advocate and educate. My thought process is, within a hospital setting, within a medical setting, there's lots of stimuli going on that's not so pleasant, right? There's beeps and monitors and machines and all of this outside noise. And so from a music therapist perspective, what we're bringing is to kind of counteract that negative stimuli and bring in something soothing that the patient has either requested, or that through our assessments we've learned that this is their preferred music. And so I think a lot of that pushback just comes from the need for more education and advocacy for the field and kind of what we do, and that we're not just in there just making noise. We are really trying to help heal our patients and make sure that we're doing our jobs as music therapists to follow their treatment plan and do the interventions that we've prescribed for them. Within our office too, downstairs is a dental office. And so I don't think we've had any complaints. Thankfully, a lot of our sessions take place in the evenings. And so, the office is not usually have anyone there at that time, but we've had that run into that issue where we've tried to maybe go look to another office space to rent out. And their first question or one of their concerns is, oh, well, the other people in this office don't want to, they don't want to be disturbed by the music. And so it's a little disheartening, but I think, again, with more education and just advocacy for the field, people will hopefully start to grasp that it's not so much as we're trying to disturb you, as this is just like any other, medicine. Music is medicine, and music is something that is being prescribed just like when the physical therapist or the occupational therapist, the doctor comes in to do their treatments. We're just as important as some of those. So that's kind of my soapbox about that. I am very it's ways, but I definitely it can be disruptive depending and on obviously case we got to be mindful of that and make sure that, like Chris next door, separated by just a curtain, maybe not banging on a drum as loud as you can, and maybe redirecting or presenting with a different instrument to try and just be aware of who else is around you.
I think these are really wonderful points, and they kind of lead into sort of the next question, as well as another thought that I had of an important distinction, I think. And this is why we're doing events like this, is to raise that awareness, raise that education for all of us. But an important distinction of that, music therapy and then music and medicine. Like Dr. Ross had a slide in her presentation as well of kind of music therapy and music and medicine, and just thinking about the study that I was reviewing last week, that's going to be our next article on the Peace Out portal. That was that was music not necessarily music therapy in terms of music as a therapeutic intervention, but music in the healthcare space. So maybe a slight distinction there, which I think is really important. And that kind of leads into this next question. So this question is coming from a pediatrician, so a physician, a pediatrician, who writes, for those among us who are gifted with musical talents, is it kosher to add music therapy? So I'm going to clarify here, because I think what she is right, because unless you're trained as a music therapist and have the training that Danielle, Megan, and Chris have, it may be considered more music in medicine, as Dr. Ross had described. So is it kosher to add music in medicine by ourselves in the relevant encounters with autistic children? If so, how do we bill for this time, and how do we standardize these? Now, for the person who asked this question, if I misunderstood you, if you are talking about bringing a music therapist into your clinic, please let me know in the question answer, because those could be two separate questions, right? One is, as the pediatrician gifted with musical talents, can you add music in medicine? This as another question, so maybe we can just address both parts of that, actually, is bringing a music therapist into your office, and how would you bill for that and standardize that?
I don't know where this person is writing from. I know that, so in my state, for example, state of New Jersey, and perhaps many other states,
They're in North
there's
Carolina.
yeah, so I don't, certainly in my state and many other states, that service would not be covered. So whether or not you're bringing in a music therapist, or the provider, him or herself, is offering that music-based intervention, there's no third-party payer who would cover that charge, that service. So that would be an out-of-pocket expense if you were to charge for it, which is essentially why I'm doing it pro bono.
I know I have several patients I know that play instruments, and so what I do is I encourage them to bring in their instruments and play, and I just schedule a little bit more time, and I treat it as in psychiatry, we're able to sort of um, bill for counseling. So I incorporate that into sort of the counseling session. And so there could be like exploration of feelings, the meaning of the music, and how its therapeutic uses in the context of the session, Um, so I have several kids that, one who brought his ukulele in the other day and played a couple songs, and he had just been actually hospitalized, in our mental health unit. So sort of coming off that, and I felt like he needed some way of sort of validating his experience. So that worked out well. Um, I just important to emphasize, I'm not a music therapist. Like Dr. Ross, I think I, I'm trying to, develop a way to bring the music into the session, so make it more music and medicine sort of an approach.
Yes, yeah. So in the medical literature, what we do as physicians, or any other provider who is not a music therapist, what we do is described as music medicine. And I think, Dr. Meyer, your approach makes a lot of sense to, kind of roll that intervention into kind of billing for supportive counseling, which is kind of just part and parcel of what we do in hospice and palliative medicine. So it essentially is kind of just part of the standard care that we provide. And I just happen to throw music into the landscape.
Wonderful. Thank you so much for those insights. We have another question. Can you speak to the overlap or differences between music therapy and play therapy?
I think a lot of what we have in common is that we're using something that's typically described as fun, right? So typically when you say we're going to do some music, that's kind of put in that leisure category. Same with play. We're going to play. So it's a non-threatening form of therapy for clients. They typically don't, think that they're coming into a music therapy session or a play therapy session and that it's going to feel like therapy. It's going to feel like, oh, we're just making music, or, oh, we're playing, but there's such a deeper level to it. And so I think that's kind of where some of that overlap happens, is that while we're both kind of that leisure-based activity, the way that we're kind of bringing the therapeutic alliance and the rapport that we're building is what's affecting the change in our clients. And so I think just the fact that we're both with a lot of these integrative therapies, I don't want to say that, they're fun, because I don't want to diminish the value of these different therapies, but they feel almost like a hobby, or like, a passion that you're exploring without really maybe even realizing that you're meeting these different goals and objectives that your therapist has set out for you. And so we're both, huge advocates for all of the integrative therapies, and whether it be music or play or art or equine therapy, there's so many different ways to use things that people love to do and make them therapeutic, so that they can accomplish whatever goals or needs that they want to accomplish.
And we have quite a few clients who explore a number of different integrative therapies. We have at least one client that's currently in play therapy as well as music therapy. So, and there is a lot of overlap, like Megan just said. I would say one major difference you would probably notice if you were to observe a bunch of music therapy and observe a bunch of play therapy, you're probably going to see a lot more recorded music being used in a play therapy session, and you're probably going to see a lot more live music in a music therapy session. That's not always the case. There are some clients that we primarily use recorded music with. It just depends on the goals and the client's preferences and things like that. But I think that would probably, that's an assumption, but I think that would probably be an overall difference if you were to look at a large number of sessions.
I think those are wonderful points. Thank you so much. And I think, again, just re-emphasizing that aspect of, and I'm really kind of honing in on this, because I think the terminology and the words that we use are really important, of just, music therapy and music medicine, or music in medicine. And, one thing that had really stood out to me in Chris's presentation and sharing some of your stories with your work with patients of, you had played the song for this adolescent, and a song that he had requested, and music that he had requested, but then in the middle of the song, it triggered, it made him want to use. And that's exactly what he was there for. It was for addiction and drug use. And so, and then you asked him a follow-up question, right? So there's this very, that just really, that story, that example really highlighted to me the therapeutic process, and that within your training, right, this isn't just going in and playing music with patients. It is, within your training, knowing to ask that follow-up question, to be able to recognize when your patient is maybe being triggered by this experience, and being able to respond to that in a very therapeutic way. And so I think making that distinction is just so vital and so important. And so I hope that, and I think that we are doing that here, of music therapy, and really that therapeutic space that you are holding and that you are trained to hold for patients and the clients that you work with. And that there is right, a place for all of this, for music therapy, as well as music in medicine, music and medicine, as we have discussed in these different, in a variety of these formats. Let's see, another question that came up: have any of the therapists used things like positive affirmations or statements in song form, especially for mental health?
During my internship, where I was at Eastern State Hospital, which is actually was the first inpatient psychiatric hospital in the country. It's located in Williamsburg, Virginia. But I actually had a client that I was working with that we did just that. She struggled a lot with self-esteem. She struggled a lot with just kind of identity and feeling worthy. She had been through a lot in her lifetime, and just was trying to get back on her feet. And so it was actually intended to be a group music therapy session. And it just worked out that it was just her and I for several weeks. And that's what we did. We came up with some personal and positive affirmations for her that she came up with on her own. And then we set them to music. And it was kind of how we started our session each week. to kind of get that into her muscle memory and help her to be able to take that away from the session and put it into her daily life, waking up in the morning and repeating that to herself, whether she wanted to sing it or even just state it. As we all know, music helps us to remember things more so than just speaking them. So as when we're young and we're learning our ABCs, and we all memorize that very quickly because it's set to a tune. And so I think just adding the music to those positive affirmations just kind of helps it to stick a little bit more. So I was very grateful to have that experience with this young woman who really showed a lot of resilience and a lot of growth in the time that I worked with her, and just really finding herself and learning to love herself again. So I think there's lots of value with those positive affirmations, especially adding them to music.
I was just thinking, I've done that myself as well. Setting affirmation to a melody, just on my own and just singing it around the house myself. So I have done that myself as well. There was another question. Is there an organization or group to connect with for music and medicine? I can definitely speak to one. It's how Dr. Ross and I met, through the American Medical Women's Association. They have a music and medicine committee, which Dr. Ross is very active in. But anyone else, any other sort of organizations or groups that you can recommend that we connect with to learn more and to stay connected with this field?
There's the International Association of Music and Medicine as well.
International Association of Music and Medicine. Yes, please do. That would be great. Anyone else? Any other groups that you know of?
I could think of, this is not specifically with medicine, and it's more community-based, but the one I mentioned in my talk was El Sistema, which actually is sort of a community-based organization that connects kids from disadvantaged backgrounds to music education, music lessons, and actual instruments. So this enables kids and young adults to have opportunities. Then this is the organization that started out in Venezuela that has since gone more globally, and can really have some positive impacts on health-related outcomes like later college placement, and employment, and actually being involved in the community activities.
Great, thank you. If you guys think of any other organizations, please feel free to drop those in the chat box so that we can share that with the community and attendees. So, so a couple more questions, a couple of questions that I came up with that I would love to kind of go around and have all of our panelists share their, offer their input on as we begin to wrap up. So these final sort of two questions as we begin to wrap up. So one is, if you could wave a magic wand, what changes would you want to see to bring music more into healing spaces?
So an idea that I've brought up with the integrative care team is having more volunteer musicians come into play. Not necessarily, um, you know, well, yes, I would definitely like more music therapists, because as of right now, I'm like the only one. Um, but like having volunteers come into play, and provide environmental music. We have the harpists who come in and play in the hallways, and if we could get like other instrumentalists to come in, I think that would be pretty cool. Other, string players. Wind players might not work right now because we're masking. So I say like strings, percussion.
Yeah, I think one thing is too to have a space for that, and to have a space that manages the sound challenges that can arise when you're bringing music into the inpatient atmosphere. And I know they can differ. I mean, with the medical hospital versus like a mental health inpatient setting, you can probably get away with generating a little bit more sound in the inpatient um, psychiatric setting, but having a space available to bring groups of musicians and maybe have those inpatient jam sessions, but we're gonna have to contain the sound a little bit too and dampen that down a little bit. But I think that yeah, Chris brings up a great idea.
I think for us, it would be, and this is a very generalized, but this would have to be a huge magic wand, that people would understand that health and well-being is holistic, and just bringing more awareness into these different integrative therapies, but specifically music, that music is therapeutic, music is medicine, and this is how we're using it as therapy and as medicine. And so I think, that if people just were more aware and more in tune with the fact that healing involves so much more than just, our typical what we think of with medicine, that if we could just kind of broaden those horizons and broaden those perspectives to incorporate these different ways to heal, in addition to the typical practices, but bringing in a more holistic just approach in across the medical system, I think would be our
Just open everyone's mind
yeah.
a little bit more.
I think for me, one of the things that really struck me was during the holiday season when we did caroling in the hospital. We initially had the thought, oh yes, we'll do this, we'll offer this to our patients. But I was really struck by the impact that it had on the staff. And they were actually they were hungry for the joy that the music could bring, and for the togetherness and all these good things that can come about when music is involved. The camaraderie, the joy, just for a brief moment in time, the environment just seems so much softer and so much and cozier and more welcoming and more inviting, and like a place where you actually want to be. Because sometimes the space feels just like the opposite of that. And the only way that we can really serve our patients well is if we ourselves are well. I had to kind of learn that the hard way. And so I would really like to see more of an effort to encourage our healthcare providers, our staff, our employees, just kind of embrace it. I know we have professional musicians, some of our nurses, some of our housekeepers are musicians also, vocalists, guitarists, saxophonists, and I think if we give them an opportunity and a space, they can kind of fill our hospitals with just the sound of music and all the benefits that come from that.
Wonderful. Thank you so much, everyone, for sharing those ideas. And, when we ask this kind of magic wand, it's not always so far-fetched, right? We have to put it out there, and we can sometimes be surprised about what we're able to bring into fruition. And, some of the things that you said, Danielle and Megan, we are, as a foundation, we are on a mission to, raise awareness that there is so much more that goes into healing, and that really is holistic. And, speaking to kind of what Dr. Ross had mentioned as well, I was watching a documentary, and it was part of they did a clip of this documentary. It was part of a panel discussion that took place recently at the Kennedy Center on the healing arts and environments in medicine, and they were talking about that as well, right? During the height of the pandemic, when they brought in different musicians and artists in New York City hospitals and in the lobbies that the staff, physicians, the musicians were surprised that staff and physicians specifically were going up to the musicians and saying, thank you. The days that you are here performing, our patients are less anxious. And this was, anecdotally that they were noticing, and they were saying that our patients felt less anxious. And in the article that I alluded to, that is going to be coming up in the Peace Out portal in the next week or two, the article that I'm reviewing currently, they talked about this happy staff, happy patient effect, and happy patient, happy staff effect, right? It goes in both directions, right? And that when art, and it was talking about art and music in the environment, and that, when that led to more calm patients, led to more open communication between patients and staff, led to more job satisfaction and fulfillment for the nursing staff. So it affects everyone in this healing environment, which is just so incredibly powerful and important. So final question that I want to present to all of our panelists here: social prescribing. Social prescribing is an area of great interest here at the Foundation. Social prescribing is an approach that connects people to activities, groups, and services in their community to meet the practical, social, and emotional needs that affect their health and well-being. In countries such as the UK, physicians prescribe healing arts and community events to their patients, and community link workers help connect individuals to these activities. In countries such as the UK, where this is set up, this is actually already integrated into their health system. We currently do not have a formal social prescribing system here in the US, although there is growing interest. Where do you see the future of social prescribing initiatives here in the US?
I think one example of that I came upon was in looking at Dr. Hujak's work at Vermont, and his approach has been based on promoting wellness and focused on brain growth, having a healthy brain, and essentially, which if you have a healthy brain, you're gonna make good choices for the future. And so, particularly in his approach to incoming freshmen at the University of Vermont, he set aside a specific dormitory which is like designated substance free, and all the residents of the dormitory get a violin or a viola, and they also they're enrolled in mindfulness, and they have a special dining hall which has a prescribed sort of diet, which is not your typical more of a Mediterranean sort of diet or paleo diet, but more focused on helping. So it's 5-pronged: it's nutrition, fitness, mindfulness, and music training. And the fifth one, I'm thinking the fifth one is sleep. Yeah, so having good sleep, and so you actually doing a social prescription for those 5 elements. And since enacting this, they've been able to show that these students that go into this dormitory situation have much higher graduation rates in 4 years, and also much lower dropout rates. So in this program, I mean, that's a form of sort of social prescribing, and I think it'd be great if we could see that more widespread, so that it would gain some impetus and acceptability with the general public. It's like, well, my doctor's going to write me a prescription to get out of the house 4 or 5 days a week. One thing I found in working with patients is when you write a prescription, they take it seriously. So so I think that's a really great idea.
I think for me, one of the things that I've come to realize is that access to music, music-based interventions, access to the arts overall is really not equitably available in the United States. If you come from a background that has a lot of resources, then you're more likely to be exposed to these things. And children growing up in communities that have fewer resources have less exposure. And I spent some time in conversation with a young man who has really developed an after-school program for at-risk youth in his community. And he is literally saving lives by using music to engage these young people who otherwise would have fallen prey to all of the awful things that can happen if they're not actively engaged in constructive activities. And so I think this is a real area for further focus and investigation, because kind of related to what Dr. Meyer was expressing, you know, if you're saving lives and you're providing young people with opportunities to feel good about themselves and to be productive and to believe that they can actually achieve. And if you're doing this, whether it's through music, this is what he's doing, but through other art forms, then I think the benefits of that, there's just a ripple effect. And I really think this can be a remedy for addressing a lot of the ills that we're seeing in our society. So, yeah, social prescribing, I think in that aspect is powerful.
I think prescribing would be a great idea. I think it would be the beginning of a real paradigm shift in the hyper individualized culture that we have in the United States, where people are becoming increasingly lonely and isolated, and you can't fix those problems by yourself. And if your doctor says you need to interact with people, you need this sense of community and belonging. That is how you fix loneliness and isolation. It's community and belonging. If your doctor says that, like, oh, I really do need this, maybe there's something to it, then you can join whichever, community group. It doesn't necessarily have to be music based, but something that gets you involved with other people in a positive way. I think it could be the start of like a real paradigm shift. Something great.
Yeah, I mean, and I think I definitely agree with everything that everyone has said. It seems like we're starting very slowly to make that shift. I mean, Danielle is working in the Brock Cancer Center in Virginia Beach, and that's a relatively new facility that's just opened up. And the amount of integrative therapies that they offer that are of no cost to the patients is such a beam of light. It's such a hope, gives us hope that more facilities can start to adopt this sort of social prescribing, this sort of using alternative therapies to reach their patients. So I think it's something that we should already be doing. I think it's great that there's other countries that can set an example for what we should be doing. And I think that that's what we should all be striving for, no matter what field we come from. If we're in the healthcare profession, it's so important to just make sure that our patients and our clients are getting what they need and what they actually need, and not what maybe society tells them that they need, or what other doctors might just want to prescribe them, but actually really getting to know them as a person and seeing what different social activities or therapies that they could be involved in to help just, again, with that idea of holistic healing.
And to give due credit to the local medical community, I will say we've had a lot of informal versions of this where we've had parents come to us and say, the child psychologist or our primary care physician recommended that we might look into music therapy. And then that's how they did a search and found us. So it's happening informally, and we're excited about that and grateful for that. So we have high hopes.
That is so wonderful. Thank you, everyone, for sharing. A great big thank you to all of our speakers and panelists here this morning. Your insights and wisdom and experiences have been so valuable. I know that I have learned a lot, and from all of the comments in the Q&A box throughout the session, I know that our attendees have learned a lot as well. This final question that I asked about social prescribing leads us into, I would love to share with all of you that as a foundation, this is definitely an area of interest of ours and that we are looking to raise greater awareness of as well. Obviously, there's a lot of pieces to bring something like social prescribing into the system on a national level. So we are doing our part, at least here on a local level, on a community level. And that being said, we plan to and hope to continue to organize more events like this. This is our first annual Healing Arts and Medicine Conference. We also are planning other events in the community that align with this concept of social prescribing, again, from the community level. One of those being in honor of Social Prescribing Day, which is on March 14th. I alluded to this earlier, but we will be having an in-person event here in Hampton Roads. It will take place in downtown Norfolk, and we will be having a movie showing of American Symphony. This is a documentary that recently came out with John Baptiste, a very amazing musician, and his wife, who is also a musician and an artist. And this documentary follows their journey of leaning into creativity, the healing arts, music, and art, while she was receiving treatment for leukemia. And that will be followed by a panel discussion. So we will include the link to register for that free event in the chat box. So definitely take a peek at that and save the date on your calendar for that. A few other things that I wanted to mention as we wrap up this morning's session. One is that we will also be putting up a link for a feedback survey. As mentioned, this is our first annual event of this type, and so we would love your feedback. Please let us know what you enjoyed, what you hope to see more of in the future. We are, one of our missions is to serve as a community resource. So we want to make sure that we are meeting your needs. And the best way that we can do that is by getting your feedback. So please share your feedback with us. For those of you who signed up to participate in this conference and are seeking CME credit. So the way that will work is we are partnering with an organization called CME Phi. And so we will be sending out links for you to claim your CME credit. Those links will be sent to your email. You will need to follow those links, answer a couple of just reflection questions about what you learned, what you gained, what your insights were through this conference. After you complete those questions, you will automatically be receiving your CME certificate. You have until March 10th to complete that. Let's see. We encourage you, if you know anyone else who would be interested in this conference, in the content that we covered today, as I mentioned, we will be sending you the recording. Anyone who has, purchased and already registered to attend the event, you will be receiving the recording. But if you know anyone else who is interested in this content, we will also share with you a link where they can go to purchase the recording as well. Please don't just forward the recording to them. Please send them to the actual registration link that we will share with you to purchase this on their own. As you know, we are a nonprofit organization. We are fully supported through the community. And so any proceeds from them registering for the event directly will continue to support this mission, continue to help us bring more events and educational events and community events like this to you. And finally, I want to just thank our speakers once again, thank our supporters, and thank Wendy, and thank Jennifer Chapman, as I mentioned, who is sitting behind the BGF logo here. We couldn't do any of this without you. And I would like to pass it on to Wendy Goldberg for our final remarks.
Well, I just wanted to say, I don't know if you can see me, but the screen for thank you to our supporters is still up. But, you know, it is just such a joy to be a part of this space. And, you know, one of the things that I think makes this job or our work fun is the collaboration. And so conferences like today, where we can share ideas and know that there is a ripple effect happening and connections are being made. And, you know, we always don't have to know the impact of some of those things, but we know that it is happening because we see it play out in the world. And, you know, just thank you again to Dr. Ajmani. You are a natural mediator for us. And this was again, our first conference. And I think I can confidently say it was a success. So we look forward to bringing you more of these series of the healing arts again in the future, at least on an annual level. So, you know, again, we are a young and growing organization, and all of the proceeds from today and the ones we receive as donations go to help support our mission and our work to transform the healthcare experience through the arts. And I just want to say again, a big thank you to everyone involved, and thank you for being a part of our mission.